Evening to one. Welcome to this ECV webinar, Alembic Pharmaceutical Learning Platform for Field Vet. I will Mr. P. Karunanidhi, Senior Vice President, Pharmaceutical Limited, our today's eminence, Ortho Karunanidhi sir.
Good evening to all the participants. There are numerous webinars Alembic has conducted so far, and this is one more feather in Alembic endeavor to disseminate the knowledges, bringing this knowledge from eminent speaker from across India, from various universities. And today I take pleasure in introducing Dr.S.Dharmaceelan, who is presently working as a professor and head Department of Veterinary Surgery and Radiology in Veterinary College and Research Institute, Namakkal. This college belongs to TANUVAS, Tamil Nadu Veterinary Animal Science University, Chennai. Dr. Dharmaceelan has done his master's in laparoscopic surgery, and it was the first publication in India on laparoscopic ovuohysterectomy in dogs. He got ICAR JRF and SRF for his higher studies. He has worked as a senior research fellow in ICAR scheme in Madras Veterinary College for the period of 2 years. He has joined in the university as an assistant professor in the year of 1999 and promoted as an associate professor in 2008 and to the professor level in 2013 and completed 21 years of service. And he is a roaring practitioner, because if you see his clinical complex, which belongs to Namakkal Veterinary College, there are several wards. He is in charge of surgery ward, and morning to till afternoon time, there will be so many surgeries are conducted by him. So it's a roaring practitioner in the college. He has guided 8 PhD and 12 MUSc scholars so far. Dr. Dharmaceelan as an individual received prestigious awards of Fellow of Indian Society of Veterinary Science in the year 2019. He also received M.N. Menon Award for the best PhD thesis in veterinary surgery and radiology. And Dr. Dharmaceelan also received KJ Hospital Gold Medal for the best MUSc thesis in veterinary surgery and radiology by Tamil Nadu Veterinary and Animal Science University. He also received a certificate of appreciation under NAIP scheme towards commendable contribution in developing e-content for the VCP courses, that is veterinary surgery and radiology courses. He was a co-investigator in NADP scheme on augmenting animal productivity and advanced veterinary care delivery through continuing veterinary education to the field veterinarians. The project cost was 176 crore, 76 lakhs, funded by Government of Tamil Nadu and NABARD on the name of construction of large animal referral hospital and machinery equipment by TANUVAS. He joined in Veterinary College and Research Institute in Namakkal and contributed many things to improve the department. To state few, instrumental in establishing small and large animal theatre, operational theatre at VCRI, Namakkal, helped in establishment of BRC approved X-ray lab at VCRI, Namakkal, standardized diagnostic and surgical protocol for GI tract obstruction in cattle, and has handled more than 100 intestinal surgical cases in cattle. As a team, standardized inhalation anesthetic protocol for intestinal surgeries in cattle. As a team, standardized low flow of inhalation anesthetic technique for abdominal surgeries in cattle, and also standardized the diagnosis and anesthetic protocol for diaphragmatic hernial repair in cattle. Helped to standardize thoracectomy surgical techniques under inhalation anesthesia in cattle. Also helped in standardizing anesthetic protocol for thoracotomy in cattle. Also, Dr. S. Dharmaceelan has established small animal operation theatre and large animal operation theatre with necessary equipment. and instrument and working to facelift the department of VCRI Tirunelveli, which is newly constituted college and part of Tanuvas. Dr. Dharmaceelan has published 132 articles as on date in various national and international journals, including our Society Journal. He has contributed chapters for 3 books. He has served as an external examiner for UG, PG, PhD in various universities, and also served as an external expert for selection committee of faculty in the universities. He has conducted training programs for field veterinarians of Tamil Nadu and veterinarians from other states. Normally, these type of programs are conducted by Namakkal Veterinary College in-house program, which was initiated by the present dean. To say a few words about his wonderful family, Mrs. Santi Vimala Rani, spouse of Dr. Dharmaceelan, is a postgraduate teacher in Tamil Nadu Government Higher Secondary School at Namakkal, and his daughter is pursuing her studies in Government Stanley Medical College, one of the prestigious medical college in Tamil Nadu. She is studying her medicine. So this is about Dr. Dharmaceelan. I request Dr. Dharmaceelan to start his presentation as our participants are eagerly waiting. Over to Dr. Dharmaceelan.
Am I audible?
Audible, sir.
Yes, sir. Thank you very much. Good evening, everyone. And I'm very happy to deliver this lecture through Alembic Pharmaceuticals. And I'm in depth thankful to Mr. Karnadadi, Senior Vice President of Alembic, who has initiated this program. And he wanted me to deliver this topic for the academician and field vets. Good evening, everyone. My given topic, I thank Karnadadi for my encomium. I don't deserve for it, but by God's grace, I got all the things as whatever he read about me. We'll go on to the topic. We don't want to waste time because already it is 5:10 now. My topic is wound management and economic importance. Nowadays, in field level or as well as in the hospitals, so many wounds, many type of wounds are coming to the hospitals, and we are facing many problems in treating the wounds. As a few words, what type of powders has to be used, what type of ointments has to be used, what type of solution has to be used for what type of wounds. This is the question asked from a friend to me from Madurai. So I thought we should give some inputs in treating or in the management of wound. When I'm going through this, the best quote for the wound is primary goal of the wound care is not the technical repair of the wound, but it is providing the optimal condition for the natural reparative process of the wound to proceed. So our aim, as a veterinarian, our aim is to provide a conducive environment, to provide a better environment to the wound, not a technical things. You can say many technical things to anyone or everyone, but in a practical, if you're thinking practically, it's not possible to implement all the techniques, but we can provide the environment. So that is a major quote in the wound. So we should provide the environment for better healing. So as a topic is economic importance, what we should think of. So it should be a cost effective also. Whatever we select, whatever the technique we select, or whatever the whatever the optimal conditions we provide to the animal, it should be a cost effective to the farmers, and also it should provide better healing and early healing. So with this, we'll move on to the introduction. So It's a healing. Healing is a complex process. It is not a. It not happen in a single day or 2 days or 3 days or 5 days. It depends upon the wound condition. It depends upon the location. It depends upon the various points which I will deal in for the slides. So it is a complex coordination of cellular mechanism. It is a biological mechanism. So it is a cellular mechanism and biochemical process. It combined together that forms a complex. That forms a wound healing complex. So it is some wounds will not heal. That is chronic. We call it as chronic wounds or ulcerating wounds. Some wounds will heal fastly. That depends on the body mechanism. As a clinician, so we should act as a positive catalyst. So we are helping. That is, we are helping the wound to heal faster. So that's why we are providing a better environment to the wound and accelerating the wound healing with a minimal scar. The aim of the wound healing is minimal scar and deformity. If it's a joint wound, near a joint wound, so it should not go for any deformity, or it should not. In human being, they'll be mainly focusing on the cosmetic effect, but we are not mainly focusing on cosmetic property, but we are going for minimal scar and deformity, minimal deformity without complication. So this is about our aim. This is our veterinarian's job in the field level or in the hospital levels. As we know, there are several types of wounds will be coming to the every day to the hospital. So clean wound, what is it? That is clean wound is surgical wound, the contaminated wound. So animal will be in the sand or a mud or clay. So with the clay or with the sand with the dung particle appear smeared over the wound, that will come. That is called as contaminated wound and a septic wound. So when it is bacterial growth is bacteria is multiplying in the wound and producing toxin, that wound is called as infected wound or it is a septic wound. So here I want to stress a point: the golden hour of wound. The golden hour of wound is 6 hours. If a wound comes with contamination, wound comes with the clay or mud or anything, within 6 hours of occurrence, if you clean the wound thoroughly without any contamination, if you clean the wound very clearly without any bacterial contamination, if you allow the wound to heal, that time is called as golden hours. If it is below 6 hours, that time is called as golden hours. If you attend the case, the wound healing process will start very fast. Within 1 or 2 days, it will heal. The granulation will come. The wound healing will be faster. When it is beyond 8 hours, what will happen? This bacteria present over the wound will get multiplied. And there will be toxic production in the wound, and it gets infected. So there will be pus formation and infection. Again, it goes for septicemia, and it turns into a septic wound. So we call it a septic wound. So this is a normal wound process, and we used to encounter burn wounds, snake bite wounds, gunshot wounds, dog bitten wounds. So bite wounds. Nowadays, there are more of bite wounds are admitted in the hospital because of the stray dog population. So whenever the animals are going for grazing in an area where there are more of stray dogs, so they prey. So they will bite the animal, especially sheep and goats. So more here in our hospital, we are attending more than 2 or 3 cases every day, dog bite wound cases. So that too in sheep and goats, and also more of fractures. It causes more of fractures also in the extremities. And decubitus ulcer. So this is also a common. This is also a common condition where the animal goes for downer curve syndrome or the downer curve. So this causes pressure over the joints. So the skin over the joints are pressurized due to the constant lying down. So that causes ulcerative wound, that is called decubitus ulcers. And this is a very tedious process and tedious condition where which it takes more time to heal, because animal will always fall over the again and again. It get inflicted on the same area, so the wound healing process will be delayed due to the downer condition. Then this is also a common condition: road traffic accident. This is common in small animals. in cats as well as in pets, in dogs. This road traffic accident, wound with fractures or without fracture, wound deglowing injuries. So the road traffic wounds are any area. It happens in any body area, even in head thorax, and also in limb area. So this is also common wound attended nowadays. And this is a deglowing injury. This commonly happens in bite wounds. So bite wounds in the extremities. Uh, the skin will peel off. Once the skin is peeling off, this is called as deglowing injury. Again, if you clean it within 6 hours, if you clean it and resuture it, again this will be all right. Again, the healing process will start and they will unite. If it is more than 6 hours or 8 hours, a septic wound, it comes to a septic wound. If it converted into a septic wound, that healing will be delayed and it is very difficult to heal these type of wounds. And fighting wound is also very rare, rarely occurred, but when animals are grazing, going for grazing, and they will fight each other, that causes fighting wounds. And again, faulty critical hook application as well as bite wounds are common in during cowing or kidding or during parturition. When you are going for a faulty critical hook application, that will cause inflicted wounds. So cut wounds again, when dogs or any cats is going in underneath this fencing or jumping over a fencing line, that causes cut wounds, or any sharp object in the household things, that also causes cut wounds in animals. The snake bite wounds. So the typical fang marks will be present in the snake bite wounds, that we have to find out, and also the clotting time. If a clotting time is more than 20 minutes, it is suggestive of a snake bite. So you have to go for anti-snake venom and you treat the wound as open wound afterwards. Suppose in case of any this viper bite, instead of Bopra, viper bite, that causes cytotoxic, that causes damage to the tissue. That may come as an open wound, or that may become as a necrosed wound afterwards. That also you have to treat it with a proper care. This is a cut wound, again a sharp cut edges, sharp knife or sharp edges. This is maybe a vengeance by the other near neighbors or something else. Somebody will be hitting their other owner's animal while grazing in their land. That will happen. This also admitted here in our hospital. There are 3 or 4 cases like that. So cut wounds will come to your hospital. So this is about the various types of wounds. So what we are encountering daily in our daily practice. So how to treat this wound and how to treat other wounds also. That is my aim of presentation. So here the wound is mainly involved in the skin layer as well as in the muscle layer. More than that, it won't go. We are encountering more wounds on the skin and subcutis layer. So to understand, this is the stratum corneum dermis subepidermis layer. So stratum corneum, stratum lucidum, stratum granulosum. So up to this, there will be the wound healing will be faster, and if it is more deeper, so again we have to take care of the wound, and we have to go for any topical medication or parenteral medications. Coming to the wound, again, we studied it is a disruption in the continuity of the soft tissue. It is a complex biological process I've seen, I've told, and organized into phases which will overlap. Suppose you cannot say that today it is an inflammatory stage and tomorrow it is a repair stage and day after tomorrow is a maturation stage and wound remodeling stage. It is not like that. So every phase of wound healing will overlap. We cannot. That depends on your wound treatment. That depends on your wound care. That process of healing will overlap one another. That will be seen. Then goals of wound care. Our aim should be, we should facilitate the hemostasis. So we should improve the blood circulation to the particular area, and we should decrease the tissue loss, as well as we should, again, it should not go further necrosis. If we prevent further necrosis, prevent further damage of the adjacent structure. That is our aim. And we should promote the wound healing, yearly promotion of the wound. That's why there are so many products are available in the market nowadays for early promotion of wound healing. And also our aim should be minimize the scar formation, yearly healing, and minimize the scar formation by application of better techniques. Then in our aim also to reduce the pain on the wound, the nerve, because any wound will cause itching on the nerve endings and causes pain, and the wound healing should be quick. And again, excellent osmosis. Suppose if in a facial area or in a vaginal part or in a area which is or in the digital part, so that should be excellent osmosis. Appearance should be good. It should be like that. You have to take care of the wound, and you have to suture or something else. You have to bandage or something like for better osmosis. And you should be more care to avoid the infection. So your treatment aim is to avoid the infection. So you have to give a painless wound healing, or it should be whatever you are applying, that should be a quick healer, and it should give excellent osmosis and divide of infection. So that is our aim and goal of wound care. Then what is the wound characteristic? The goal may be the same, but it depends on the goals. Maybe depends on the nature of the wound, the X-ray. So we say the X-ray, serous X-ray, serosanguinous X-ray, purulent X-ray. So there are so many types of X-ray. So it's a clear serous X-ray, or serosanguinous X-ray, or sanguinous X-ray, or it's a purulent X-ray. So what type of X-ray is coming from the wound? That gives a glimpse of the you glue to the veterinarian for the treatment. If it's a pus, so you have to clean the area and you have to eradicate the contamination. Then you have to apply for the better healing agents. Whereas in case of serous X-ray, it's a fresh case, it's a very serious X-ray. Just you can apply, you can go for antiseptic. No need of antibiotic. So if it is serosanguinous, again clean it for 1 or 2 days. Clean the area, then secondary admit it for secondary healing, then go for the application of your antibiotic and antiseptic oil. So like that. So according to the X-ray, it varies. That goal, your treatment should be initiated according to the X-ray, whatever the X-ray you are seeing in the wound. Then elective versus traumatic wound. So elective means it is a surgical wound; it will heal faster. And if it's a traumatic, so there's a lacerated wound or abrasion wound, and puncture wound or a penetrating wound, whatever may be traumatic. So it may contain organism, that is a microorganism that goes for septicemia. So elective wound, there won't be much microorganism. It is very easy to heal. Whether traumatic wounds are very difficult. Unless otherwise you are clearing the debris and contamination as well as the bacterial growth. And location and orientation of the wound. Again, location of the wound is very important. If it is located on the thoracic area or abdominal area, there will be much movements in the abdomen and thoracic area, and as well as in the facial area. Whereas in the neck, limbs, and tail, these wounds are always moving. So the healing will be delayed in case of a wound is present in the neck, extremities, as well as in the tail. And as well as orientation. Orientation means if the nerve fibers or blood circulation is continuing in the wound surfaces, that wound will heal faster. If the wound, if nerve circulation is cut and the blood circulation is cut over the wound area, that will take more time than the other wounds. So that is also important. Location and orientation of the wound is also important. You have to watch for that. And vascularity. This is orientation is very common in teeth wound that I will deal the coming slides. And vascularity of the tissue. Again, I told you vascularity. Highly vascular tissue will heal faster than the less vascular tissue. So it needs glucose. So vascularity and it provides nutrients. It provides a protein. It provides the nutrients and environment. Tissue, that cellular mechanism that I will be telling, cellular mechanism to the wound site, that will heal faster. And also elasticity, tension of the soft tissue. So elastic tension, if it is more tension on the wound area, that will heal very slowly. if there is more tension, especially in the joints as well as in the neck and the extremities, that will the elasticity will be more. Again, if you are suturing it, next day the farmer will come, sir, the suture adhesion has occurred. So that means the elasticity is lost as well as there will be tension on the wounds. If any complaint of adhesions on repeated adhesions, don't go for any suturing. Yeah, you should go for relaxation suture, or you can go for a just treat it as a open wounds. So degree of contamination, it is also important. Degree of contamination, there's a bacterial load per gram of tissue, 10 to the power of 6 per gram of tissue should be there, otherwise it is called infected wound. So the degree of contamination also is important in a wound condition. If it is more contaminated, you have to think it of multiple, you have to think of multiple choice of wound treatment. Come to the cells involved, this is academician for academic purpose. Platelets, macrophages, neutrophils, epithelial cells, lymphocytes, fibroblasts, endothelial. So I told you this is a complex mechanism. All the cells will come into the damaged sites of the wound. So it will help for a repairing process in every stages of wound healing. These cells will interact, grow, divide, and migrate as directed by chemotactic agent, growth factors, and cytokines. So these according to the chemotactic agents, these cells will appear in the site, and this will again these cells will grow, and this due to the growth factors, there will be secretion of growth factors. So these cells will grow as well as due to the cytokines, it will originate. It will orientation will come. So this is the complex mechanism of the wound healing by the cell various cells. So this epithelial damage, again the proliferation, fibroblasts will occur. Again, every this is corneal remodeling, this is skin remodeling, so like this, the muscle remodeling. So every cells are involved in better and early healing of the tissues. Again, coming to the healing process, I will go through quickly because I have to enlighten the various wounds. So I am going through very fast. Please follow me. The inflammatory process, again, any wound immediately it occurs, it results in inflammation. Again, cardinal signs of inflammation, you know, the pain, swelling, redness, and that is scalar, tumor, rheumor, functional loss. So this will occur immediately after a wound is happening. So this it prevents the systemic complication. This inflammation prevents the systemic complication by controlling hemorrhage and initiating the local immune mechanism. So whenever immediately after a wound happens, there will be bleeding. So there will be bleeding and blood. It should clot. So this complex mechanism will start, and there will be factors will initiate the chemotactic factors that will initiate the hemorrhage, blood clot, and there will be a cellular mechanism where the platelets will aggregate, and there will be it will start the clotting mechanism. So clinician's first charge is response to eliminate the inflammation. So you have to, in this stage, suppose in a case so it anti-inflammatory, not daily. It should not go for anti-inflammatory drugs because inflammation is a normal process. It needs for wound healing. So controlling the negative. Suppose if you are giving an anti-inflammatory, so it controls the negative effects of inflammation. Is beneficial to the patient provided cellular and chemotic functions are necessary for wound healing. However, elimination of entire inflammatory response will prolong the wound. So daily don't go for any inflammation. Once the inflammatory process subsides, so I want to stress a point here. 1 or 2 days, you give anti-inflammatory for 1 or 2 days, and from 3rd day or 4th day, if it is swelling is not subsided, you proceed. If swelling is subsided, stop the anti-inflammatory drugs. So my humble request, you stop the anti-inflammatory drug after 2 to 3 days. Don't go continuously administer the anti-inflammatory drugs for 5 days or 7 days. It's not necessary. So that you have to assess the wound. If the wound edges are normal, if the wound edges are not swollen, if the wound edges are normal with the skin surface, so there is no need of anti-inflammatory drugs from that point of days. So don't go for anti-inflammatory drugs for 5 days or 6 days. So stop it for 2 to 3 days. Assess the wound. then continue with the anti-inflammatory drug. That is my humble request for each and every practicing veterinarians. Then healing process, again, next process again, the after inflammation, debridement. So the wound bed is soiled, it will be having bacteria, it will be having having the contaminated materials, organic materials. So that has to be removed. So that has to be removed. This clot will form a fibrin and it will become a scab. So any closed wounds, if you see our lacerated wound, if you see our operated wound operations, there will be scab formation by the clotting mechanism. Over there is a layer of scab is formed. That scab protects from the injury. That maintains the moist environment for the phagocyte and fibrin. Once the inflammation process is running, so there will be phagocytosis of the phagocytic cells. That phagocytic cells and fibroblast cells will migrate into the wound. That forms a scab and that replaces the macrophages will enter into the wound that engulf the bacteria, that engulfs the organic material from the wound surfaces. It maintains hypoxemia as well as acidic environment that inhibits the bacterial growth and stimulates the fibroblast proliferation. So this scab formation also maintains the hypoxemic state and stimulates the fibroblast proliferation. Then this again, once the debridement stage started, the chemotherapy factors that attract the neutrophils and macrophages in the wound area, that also removes the necrotic debris and foreign bodies and bacteria present over the wound surfaces. Then coming to the next stage of healing process after inflammation, debridement, next stage is repair stage. The third one is repair stage. In repair stage, there are 4 stages are available, 4 planes are available. First plane is fibroplasia. Soon after injury, the fibroblast moves out of the connective tissue, adjacent to the wound, and migrate across the protein lattice and form a clot. So once the injury is occurring, the fibroblast will move, that forms a clot. The fibroblast replaces damaged debris or damaged dermis with the ground surface and collagen. This collagen forms a scar. So fibroblast and collagen makes the scar formation that is structurally altered and functionally interfere with the original dermis. And coming to the next one is there is fibroplasia. Next one is granulation. So this is an olden period. It is called as secondary intervention healing. Secondary healing or healing by granulation. So highly vascular connective tissue. Granulation tissue is a highly vascular connective tissue. Again, I want to tell you one important point for the field veterinarians or field practice. So once granulate bed is formed, there is no need of any antibiotic. So it is the granulation tissue is resistant to infection. Please note it down. The granulation tissue is resistant to infection. There is no much antibiotic needed after granulation tissue is formed. So how to assess this granulation tissue? The granulation tissue is a new vascular tissue. It is a new vascular tissue with a newly erected blood vessels. New endothelial cells will migrate and form the blood vessels. So new blood vessels are formed in the bed, and new cells are forming, and it's a bright reddish in color and with a new blood vessel. So that indicates it's a granulation tissue. It grows from the base of the wound, and fills the cavity. It fills the cavity. That indicates the granulation. Once the granulation tissue is formed, there is no need of antibiotic coverage. Only antiseptic is needed, or mild antiseptic is needed. There is no need of antibiotic or process of parenteral antibiotic in this condition. So this is my point. I want to stress the point on granulation. The granulation occurs by the process of angiogenesis. Again, the blood vessels will form, endothelial cells will migrate, and anastomose to vascularize the wound. So the endothelial cells will migrate, angiogenesis will occur, the vessels will migrate over the new cells, and it will anastomose each other. This mechanism that controls endothelial cells and fibroblast proliferation. Again, it will not be much proliferation of fibroblast from the granulation tissue. That is ill-defined in books or in science. We don't want to confuse that one. So once granulation tissue is formed, the migration of fibroblast will stop. The hypoxia also seems to play an important role in granulation tissue. Then comes epithelialization. So again, dermis layer should form. The epithelial layer should form to cover the wound, cover the external wound. So epithelial cells at the wound margin. Again, the wound margin, epithelial cells also will migrate and proliferate to migrate over the granulation tissue towards the center of the wound. So imagine from the edges of the wound, slowly the epithelialization also will start Once it grows from the below the cavity, it grows. The granulation tissue will grow like this, and the epithelialization will come like this. So it completes the wound healing. The epithelialization is complete when opposing mud. So from the wound edges, the epithelialization will come. When it touches each other, the epithelialization will stop. So contact inhibition prevents the further. So once the epithelialization contacts, that will stop the epithelialization. Further, there won't be much epithelialization process will occur. So again, I want to stress a point here: the epithelialization, zinc oxide. Suppose in a chronic wound in large animals, a large animal chronic wound in limbs as well as on the abdomen area, wound, any wound, a chronic wound, ulcerative wound, that won't heal because of the initialization, because of uh, uh, absence of epithelialization. To promote epithelialization, this zinc oxide ointment, if you are having zinc oxide ointment, or if you are any combination of zinc oxide with other ointments, that will be better. That will be better for that is better for epithelialization stages. Once the growing wound is granulating wound is there, and it goes for exuberant granulation, excess granulation tissue. That is because of the absence of epithelialization. So you start the epithelialization, your big ointment, BABP. Big ointment is also, you can make the big ointment. That also promotes epithelialization. That also soothing agent. It also acts as a soothing agent. Zinc oxide also, it promotes epithelialization. So please note it down: epithelialization for chronic wound healing in large animal practice. Think of zinc oxide ointment as well as big point, BABP, big point. Bismuth supplemented paraffin paste, bismuth iodide, iodoform paraffin paste. Epithelialization is complete when opposing. That's why I've already tested. And next stage maturation. So repair stage is over. Now maturation. The wound has to mature. Every cell has organized. So epithelium, the granulation tissue has been grown from the bed, and epithelium has come from the dorsally. So every cells are organized, but it has to mature as a skin cell as well as muscle layer as well as subcutaneous layer. That is called as maturation. So that is orientation. The skin orientation has to come, muscle orientation has to come, and the subcutaneous orientation has to come, or any wound in the other area, that is intestinal wounds or any wound, that has to remodel. That is called remodel or maturation. So it has to remodel to its original tissues. That is called as maturation stage. The modeling of the collagen scar tissue occurs over the next several months. So it takes next several months. The collagen matrix initially produced in the fibroblasts converted into type 3 collagen and type 2 collagen. So reorganization of the structural cross linkage developed between the collagen fibers increases the tensile strength of the scar tissue. Then comes contraction. So once it is organized, it has to contract. Otherwise, what will happen? The wound surface will be, it will not reduce. So there should be a contraction of the wound. Then only it will heal. It will heal properly. So if it is not contraction, the contraction is not proper, that goes for ill effect, a cosmetic effect. So cosmetic effect will not occur if the wound is not contracted properly. So wound contraction is the centripetal closure. So we have grown like this. Again, we have grown like this. So it has to contract. That is called as contraction. So this gives less scar tissue, and fibroblast differentiation into myofibrils. So my muscle fibers will form, skin fibers will form. So everything will be converted into the same orientation of tissue, the myofibrillast. The contraction stops when the wound margins are opposed, or when tension across the wound exceeds the tension of the myofibrils. So this myofibrils will form. Once the tensile strength is normal, it appears to tension of skin, tension of subcutaneous tissue and other layers. So this contraction will stop. Up to that, the centripetal contraction will be there, and it goes for benefit. It is a beneficial effect for less scar tissue formation. Then this is a pictorial diagram of a stages of wound healing. The hemostasis stage, that is a blood clot, and repair inflammation stage, proliferation stage, and remodeling stage. So how the cells are organized. So neutrophils and macrophages come here. The platelets will initiate the clotting mechanism. The neutrophils, macrophages will come and it will initiate the end of the bacterial growth and organic matter in the wound surfaces. Then again, the granulation tissue will come, the collagen and the fibroblasts will come, and this is organized. Orientation, remodeling will occur to the normal tissue. Up to that, there won't be any orientation. So remodeling, repair stage and maturation stage, that orientation, the skin will form as a skin, subcutaneous tissue will form into subcutaneous tissue, and muscle fibers will form into muscle fiber. So this is called remodeling. This will take more 2 to 3 months of time. That's why we have to take care of the wounds properly in the joints area and other areas where the movements are more. The responsible factors. So whatever we do, so whatever care we do, there should be a lacunae. There should be lacunae. If you avoid these lacunae, whatever I put in the slide, the foreign bodies and contamination, foreign bodies and contamination. So there shouldn't be any foreign body. You flush the cavity or flush the wound thoroughly without any contamination, that will heal well. Necrotic tissue, you have to remove the necrotic tissue. You should not allow for infection. The movement should be restricted. That's why the bandages. So bandage will come here. We should restrict the movement for better wound healing. And blood pH. Blood pH is also a factor for acidic pH is pH environment is harmful for bacterial growth. So initially there will be acidic pH that will be harmful for growth of a bacteria. It will arrest the bacteria. That also plays a major role. Blood supply to the area, temperature, oxygen tension. So oxygen, more supply of oxygen, again the wound healing will be positive. Nutrition. Again, nutrition plays a role that I will tell you in few further slides. What are the nutrition responsible for better healing of the wounds. Again, so we have summarized this one. So we have gone for the various wound types and wound healing. Now we are educated with the wound healing. What is the wound healing? Now, so what we do in our practice, what we should do in our practice that I am going to deal with now. Examine for amount of tissue destruction whenever the wound comes. So you examine the wound, go around the wound, go around the animal, examine the wound. Again, amount of destruction, how much amount, whether it is only skin wound or whether it is up to subcutaneous tissue or the wound is up to the muscle or the bone is exposed up to the deeper layer. So muscle also involved. So amount of tissue destruction, degree of contamination, damage to the underlying structure. So this has to be assessed first. Then body location, proximity to other structures, suppose near the eye. If it's near the eye, you have to be very careful in selection of the solutions. If it is a external genitalia, again selection of solutions. So if it is near the mouth or near the nose. So location also plays an important role in treating a wound. And near the joints and nerves, tendons and vasculature. This also very important. Tendon damage or nerve damage or any vasculature damage, that also will delay the wound healing. But for that, you have to take care of other things to improve the wound healing. So test for integrity of each structure. So structural integrity, you have to, because of the wound, what is the other sequelae happen, that also you have to see for it. And assess the laxity, muscle and tendon function. So whenever the wound is near the muscle, near the extremities, near the joints and other part, you have to assess the muscle tension as well as function. Assess 2-point discriminations. Again, this is the laxity and muscle 2-point discrimination you have to assess, and vascular supply you have to assess whenever the wound comes to you. Then, so you are seeing a wound. Suppose if it's a cut wound comes to you, so it should be within the cut wound, fresh wound with the bleeding, so within 10 to 24 hours. The age of wound is 10 to 24 hours. If it is swelling, with the wound with the swelling, that indicates it is within 36 hours. If still wound swelling is there, still wound is swelling. If a case comes on 3rd day or 2nd day to you, if swelling is there, it indicates that still inflammatory, it is inflammatory stage. And union of wound, it is clean wound. Suppose surgical wound or other wounds will unite, or cut wound will unite within 48 hours. If you are properly suturing or if you are properly opposing it with a bandage, it will heal it will oppose within 48 hours. If a wound is with the opposing wound edges, you can say it is a 48 hours wound. Complete healing. Suppose if wound is healed, wound edges are epithelialized, it will take 4 to 7 days to complete the wound healing process. The secondary granulation, suppose if a granulation tissue, if you are noticing a wound, it comes to you in the hospital, if you are noticing a granulation tissue it may be a 5 days wound. So this is about the age of wound healing. You can assess it whenever the wound comes to you at your hospital. Then coming to the proper and going through the proper care, wound care. First one is wound closure. How to close a wound, when to close a wound. Suppose if it's a fresh wound that I told you, if it's a golden hour of wound, within 6 hours, your wounds come to you. Definitely you can close the wounds, unless if it's a bite wound. So bite wound, what will happen if the bite wound edge area may be very small, the wound edge may be small, but the damaged tissue inside that one damaged tissue, or a gunshot injury or a stab injury, the external damage will be less, but internally it will cause more damage and more contamination. So in that wound, I try to, if it is a vast wound, if a bite wound is very large wound, you can close the wound, bite wound, you can close the bite wounds, but with adequate drainage. So you have to leave a large suture for drainage, or you have to provide a drain sheet or a drain tube to the wound to avoid further contamination and to avoid further bacterial growth inside the wound cavity. Again, you can easily flush the cavity with the drain sheet or drain tubes. So that is the primary closure. Primary closure, you can close the wound if the wound is within 6 hours. That is golden hour of wound. Also, if that is a secondary wound closure. The secondary wound closure means allow the wound for, suppose if wound edges are not opposing. If a wound comes to you, if it is not opposing, if fresh wound, even though it is a fresh wound, you could not able to oppose it. In that condition, what you have to do is you have to wait for granulation tissue grow up to the wound edges. Then there will be contraction. So once there will be contraction, you just examine the tensile strength of the wound. If it comes for the closure, again you can close that after 4 to 7, after 4 or 5 days. Once the granulation tissue fills up the cavity and the epitheliation rods, the wound edges closure, and if it tensile strength is very less. So that is the secondary closure. Secondary closure has to be closed without any tension. Here I will put a picture. Here you can use the tension relieving suture. This is suppose if you are expecting more tension over the wound edges, what you can do is you can take a tube. You can take an IV tube, or you can take a scalpel tube. Inside that scalpel tube, you pass the thread and suture it. This will avoid the tension of the skin over the wound edges. This is a stent suture. This is called a stent sutures. You can use this IV that simple your scalpel set, or you can use the IV catheter, IV tube, infusion tube used for using the tension relieving sutures in the wound closure. Then coming to the wound lavage, this is also an important topic in present day practice. How to lavage the wound? How to lavage the wound? I given four topics. Please carefully watch it. Pressure. So how much pressure has to be given onto the wound? Some book says 80 psi. 80 psi with 80 psi. Suppose if a wound is not highly contaminated, but it is not like that. But you can use the psi level, pressure level, with 5 to 8 psi. So that 5 to 8 psi in human they have studied, and they have come to a conclusion that use a 30 to 50 ml syringe, or you can take our 50 ml syringe, or we can take a 20 ml syringe, and you can take an 18 gauge needle. If 19 gauge needle is not available for our practice, you can take 18 gauge needle with a 20 ml syringe, and you can pressurize. You can give a strong pressure over the syringe. That will give 5 to 8 psi. Please note it down. 5 to 8 psi is given with a 20 ml syringe or 50 ml syringe fitted with the 18 gauge needle, and pressurize it. If you are pressurizing it, it will give a 5 to 8 psi. They say that will not harm the normal tissue. They say it will remove the dirt and debris or bacteria present over the wound surfaces. That will not cause any harm over the normal tissue. Normal tissues are not damaged when you are using a pressure of 5 to 8 psi level. Then, how much quantity? Somebody says this is the practical case. How much quantity can I irrigate a wound? In veterinary practice, you have to use 50 to 100 ml of irrigant per centimeter of laceration. So please note it down. So if you have 1 centimeter tissue, you can use 50 ml. At least you can use 50. You should use 50 ml to 100 ml of normal saline, you can use normal saline, or you can use that. I will come later. You can, that is normal quantity has to be used for a lavage. Suppose a larger wound, you can imagine a 10 centimeter wound, you have to use 1 liter. 10 centimeter lacerated wound, you have to use 1 liter of fluid, or at least 500 ml of irrigate solution, and you use the pressure, it will clean the wound. It will clear the contaminant over the wound. Then what? Again, next question is what solution is ideal? Again, it's a practical tip. They say in scientific level, lactated ringer. Lactated ringer solution is the best solution for wound lavage, or isotonic saline is ideal. Isotonic is normal saline. You can use RL or you can use NS for cleaning the wound with the 5 to 8 psi pressure with the quantity I mentioned above. Or it may be combined with the antiseptic. So this ringer lactate or isotonic saline can be combined with 1% fluoride or 0.2% chlorhexidine. You can combine with the antiseptic also. It can be combined. Then coming to the temperature. So, sir, somebody say use warm saline or use warm solution for lava. Yes, it is recommended. The ideal temperature of lava solution should be 45 degrees. Please note it down. The ideal temperature of lava solution should be 45 degrees, and it should not exceed 60 degrees. Again, 60 degrees will cause the damage over the tissue, normal tissue. So it should not exceed 45 degrees. The lava solution can be used. Warm solution can be used up to 45 degrees. That will also help for better healing. It will cause tissue damage. 60 degrees, this will cause tissue damage. So these 4 points are important for field level. The pressure, you have to use certain pressure for removing the dirt and debris, which is not visible in our eye with our eyes. Then quantity 50 to 100 ml per centimeter of tissue. You can use lactated ringer or isotonic saline solution. Temperature is 45 degrees. Up to 45 degree temperature, you can use use for lavage. So this is the pressurization. How to pressure? You can connect it with the one IV solution to the one tube, that is 3-way tube. They are using it. They are using it from one tube. Saline will come or antiseptic will come, and with the other tube that can pressurize the thing. You can clean the wound surfaces. Or simply you can connect with the 18 gauge needle and pressurize your water. So wound lavage again a confusion. Whether can I use tap water? Can I use tap water? Yes, book says you can use tap water unless it should be very over-contaminated. Over-contaminated wound, you can use tap water for clean the contamination. Then once the contaminants are removed, then you can change the lavage solution to normal saline or ringer lactate or with the antiseptic. So animal studies have shown that tap water is as effective. I have gone through some of the literatures. It was as effective as sterile saline in reducing the wound infection and bacterial counts. So you can use the tap water unless it is an ideal one. The tap water should be an ideal tap water, and it should not have any contaminant, because you cannot use the water from the pipe or water from the stored area. So you use a fresh tap water. That should not be that should be a clear tap water for you can use for wound lavage. No significant difference in wound infection rates. One study they say that no significant rate in infection rate when you are using normal saline and tap water. Use of tap water as an irrigation fluid is recommended for large contaminated wounds. I told you it is used for large contaminated wounds, provided the water is portable. So the portable tap water. I want to stress this point. A portable, whatever some in well water. Some of the wells the water is very good. Some of the river the water will be very good. So that portable, whatever the water we can use it for drinking, for our human drinking, that can be used as lavage. That can be the better ideal water for wound contaminant. That this tap water and should be used for large contaminated wounds, not for ordinary wounds, not for clean wounds. It should be very large contaminants are present. That dung particles are present, mud particles are present, sand is present, clay is present. If that to remove the clay, mud or other contaminants which is sticky over the wound, you can use this tap water for lavage. The benefits is low cost, immediately available. So you can use it immediately. So what are the other things you can add into the tap water? I will tell in the consequent slide. So you can use the fluorinidine. So lavage solution. So 1%, 0.1% fluorinidine can be used. So 0.1% fluorinidine can be used as a lavage solution. So it can be mixed with the tap water, or it can be mixed with the normal saline, or mixed with the, it can be mixed with the rigor lactate. So how to make it? So we have 5% stock. In India, we are having 5% stock of fluorinidine. So take 1 cc of 5% stock solution and mix it with 1.5 liter of saline. That's all. Please note it down. Take 1 ml of fluorinidine, mix it with 1.5 ml of 1.5 liter of saline, and use it for lavage. I am not telling as antiseptic. I am not telling for use it as antiseptic. 0.1% is used for lavage. Please clearly understand. It is used for lavage. 0.1% concentration. 1 cc, take 1 cc of 5% stock, and mix it with 1.5 liter of saline. It will be around 1.1%. That can be used as lavage solution. At higher concentration, fluorinidine is toxic to fibroblasts. So don't use higher concentration for lavage solution. The fluorinidine is inactivated by organic debris. So it is not beneficial. So please note, it is not beneficial for contaminated wounds. If any pus is there, don't use fluorinidine. If any organic material is sticky over the wound, don't use fluorinidine. So fluorinidine is not beneficial in organic debris and if once the pus is present in the wound. So it has residual depth. So in case of dogs, continuous use of fluorinidine will cause thyroid problem. So again, you have to identify that. Suppose if you want to use that for fluorinidine because of iodine content, if you are using profusely to the dog, profusely to the wound healing or wound dressing, you have to careful. You have to keep it in mind that will cause thyroid problem. So it should be always in your mind that whenever you are using lavishly, you are using fluorinidine, there may be a chance of a thyroid problem. So use it minimally. Up to you can change it to other antiseptic within 5 to 6 days. You can change the other antiseptic to avoid thyroid problems in animals. Then next is chlorhexidine, our Savlon. It is also used as you can use it as a lavage solution. It can be used as 0.05%. That is 0.1%. This is 0.05%. You take a 25 cc of 2% stock, 25 cc of Savlon solution in 1 liter of saline. So it is available as 2% solution. That's why you have to take 25 cc, 25 ml of chlorhexidine and mix it with 1 liter of saline. It makes you 0.5%. You can use it as lavage solution. Please note it down. Chlorhexidine can be used as lavage solution, 0.05%. So it has a longer residual effect than fluorinidine and has shown greater efficiency in the presence of water. So it can be used for lavaging with the lavage for the septic wound or a purulent wounds. Any purulent discharge is there, you can think of, instead of fluorinidine, you can think of Savlon. So this is a practical tip for the field practitioners. You can go for take the Savlon bottle, take a Savlon, 25 ml of Savlon, mix it with 1 liter and use it as lavage, and you can go for bandaging also. That I will come later. Then coming to the hydrogen peroxide. So in olden days, where the fluorinidine is not available, Savlon is not available, they were used hydrogen peroxide solution. So it has an impressive foaming action. So due to the foaming action, due to the leather action, that makes the debris or organic matter present in the wound to float over the foaming action. So that will take all the debris from the wound due to the foaming action. But it not have effective bactericidal. It is not having bactericidal effect. So don't think that it will have bactericidal effect. Only to remove the debris and organic material present at the wound, you can use the hydrogen peroxide. It is not having any bactericidal effect. And it is cytotoxic at concentration of greater than 10%. So it should not use more than 10%. It is not, you cannot use the solution. It is cytotoxic. However, hydrogen peroxide maintains the sporicidal activity and may be indicated for treatment of potential spore forming bacterial infection. Suppose if you are going for any antibiotics sensitive test, we are finding any spore forming organism, then you can go for cleaning the wound with the hydrogen peroxide. That wound will be better, the hydrogen peroxide will be used better for spore forming bacterial contaminants. Then again, hypertonic saline also can be used, 5 to 7% hypertonic saline and normal saline. Hypertonic saline can be also used for a swelling wound, swollen wound. Suppose swelling is there, you can use the hypertonic saline to reduce the swelling as a lavage solution, 5 to 7% solution. And warm balanced electrolyte solution also can be used for as lavage acrylamide lotion. Again, we are every hospital, maybe every government hospital, maybe supplied with acrylamide powder. So they'll be keeping, you'll be keeping the acrylamide powder. So take a 1 gram of powder in 500 ml of water, 1 in 500. So 1 gram of, take 1 gram, 1 pint of powder, take a pint of powder and put it into half liter, or take a 2 gram of powder, put it into 1 liter of can, and you can use it in lavage. That is better. This wound healing, if a chronic wound is there, you can switch over the antiseptic to podonidine from the podonidine or chlorhexidine to the acrylamide. It also heals well. It also improves the initiation of the healing process. Then potassium permanganate, Namakkal solution, again it is available, commonly available. Farmers will be having it and they will be purchasing from the stock itself, from the stores itself. And how to use it? 0.1%, 1 gram in 1 liter. So you have to take 5 gram per pack is available. You ask the farmers to take 1 gram 5 parts. So a 5 gram pack is available in every hospitals or every medical shops. So they'll be selling 5 grams pack of KM4. So ask the farmers to divide into 5 parts. 1 part is for 1 liter, or 5 gram packet for 5 liter. So that is the easy tip, easy practical tip for the farmers to educate. So take the 5 gram packet, immerse it in 5 liter of water, then use it as a lavage solution. So this is the practical tip for the use of KM4 and the acrylamide lotion. So take a 1 gram acrylamide lotion and half liter of water. So that is a common practice, commonly available drugs for lavaging as a lavage solution. It's cheaper also. It's very cheaper also. Use acrylamide lotion, use KM4 lotion instead of a povidone lotion or chlorhexidine. This will be cause better effect than the other lotion, but it should be used. It should not be used with the cavity, cavitational wounds. What happens in cavitational wounds? After 6 to 8 hours, this chemical the chemical action will be losing, and the water logging, whatever you are using water, that water will be locked in the cavity. That it promotes the bacterial growth. So please avoid this use of whatever you were using tap water, antiseptic with tap water. Avoid this tap water with antiseptic in case of cavitational wounds. In cavitational wounds, it causes after 6 to 12 hours that chemical will evaporate. Only the water logging will be there. That beneficial for the bacteria to grow. So your effect will be vanished. So how to use this one? When the acrylamide using, there's the yellow color. If you're using acrylamide in the wound, up to how much you can use, I told you the volume. Then whenever you are putting acrylamide lotion or chemical lotion, initially what will happen? This will mix with the blood or mix with the serum or mix with the serosanguinous material present over the wound. That color will change into different colors. Yellow color will be changing into white color or some other colors. As well as the pink color will change into the pink color will change into some other color. So up to how much you have to lavage it, whenever you're using the lavage solution, whatever the using color you are using it, the same color will come out of the wound. Up to that you have to lavage the wound. That indicates that suppose if you're using a pink color, the chemical lotion, the same pink color will come out of the wound. Up to that you have to lavage the wound. That is the indication for wound lavage. So that is when suppose if you are doing podonidine lotion, the same color should come. The same color should come in with the lavage solution. Whenever using it initially, that same color should come. Up to that you have to lavage. That indicates that it has cleaned all the organic material present over the wound surfaces. And coming to the wound debridement, all the wounds needs debridement, delayed wounds. Suppose if case comes to you after 3 days or 4 days or 5 days, these wounds needs debridement. So debridement is 4 types of debridements are available. Manual debridement or surgical debridement. What we are doing it manually, you can peel off the necrosed tissue, or you can use the scissors and cut the necrosed tissue and clean the wound, make the wound clean. So you have to clear the necrosed wound and make the wound edges clean for application of your antiseptic or application of antibiotic ointment. Then next wound debridement is enzymatic debridement. There are preparations available. Peppermint with urea, that's a common preparations available in medical shop. You can use that. You can use the ointment and apply the ointment. That will cause debridement. Collagenase also available for debridement. And mechanical debridement process water jets. Again, I told you 80 psi. 80 psi. If you are putting the water into 80 psi level, that will remove all the debris and necrosed tissue stick over the. This is what they say 80 psi. But it should be carefully. It should be used. Artlet debridement maggots and fish therapy. Nowadays in human beings, the fish therapy is used for the debridement technique. So this is the manual. You can wipe the necrosed tissue, or you can take the necrosed tissue with your hands, with your fingers, or wipe with the gauze piece. Wipe with the gauze piece and take out the necrosed tissue. Leave the normal tissue to heal. So this is the surgical debridement. You remove all the necrotic tissue, make the wound into fresh edges. Also, the debridement should, again, you have to take the debridement at the wound edges also, because if you're not doing it the wound edges, there will not be any epithelialization and there will not be any wound contraction. So that will cause exuberant granules. So whenever you are going for wound debridement, edges also should be debrided and the necrotic tissue also should be debrided up to the bleeding point. How to debride? So up to the bleeding point. So the necrotic tissue normally there won't be divide of blood circulation. So up to the bleeding point you have to debride. That is the principle in debriding. So when blood comes from the wound edges, then stop. Beyond that, you go for debride. Don't go for debride. That indicates that healthy tissue has come. Healthy tissue has come. That is the principle in debridement, manual as well as surgical debridement. The manual debridement can be done in wound utter necrosis. So the necrotic tissue can be debrided day by day. Slowly you can use your fingers day by day to remove the dead tissues from the utter tissue from the deeper cavities, any wound cavities. That manual debridement is better. And coming to the enzymatic debridement, the accusine peptide urea ointment. This is xanthine ointment. This is a collagenase xanthine ointment. The combination of ointment is available in human market that is used for debridement for necrotic tissue. Collagenase xanthine, and penafill ointment. So these are ointments commercially available ointment. I'm not going much on that, deep in that. And tractate washer disease. So this is commercially available in human beings. They're using commercially available jets. So they will be keeping a pressure, and that pressure will be delivered. So what we can use this one is this is a commercial this IV cannula. We have in veterinary practice they have modified the annual cannula. This can be fixed into the sachet, and when we are pressing the sachet, that will give a pressure jet over the IV cannula. This can be a practice in your field level practice. This can be used as a remove the necrotic tissues. This is commercially available, and this can be used as with your oxygen supply unit. Again, this is a modified unit, oxygen supply unit. This can be used again. The same thing can be used with the oxygen supply unit, and IV set can be connected here. When the oxygen is supplied with the pressure, with the monitor, so with the pressure, that will give some pressure over the wound, and it will remove the debris. Then, this is a human being. They are practicing healthy lavage. Healthy larva is kept over the wound surface, and larva will take away the necrotic tissue. There is practice for mainly practice in diabetic wounds in human beings, where the necrotic tissue is more. They are going for this autolytic technique, maggot technique. And the green bottle-fly larva best suited for the chronic non-killing wounds. Application 48 hours, 2 times per week. So they will be applying the larva and they will be closing the wounds. Again, these larva will take away all the necrotic tissue, leave the healthy tissue inside. The occlusive or semi-occlusive bandages are applied. And again, nowadays it is commonly practiced in chronic wounds. Gara fish. That's gara fish used for human diabetic wounds. And for veterinary practice, again, practical tip, this is given by one of my Asmbros a few hours back. So what we are suggesting it, if you are near riverside, if you are a riverside practitioner, so if a chronic wound is in present in the limb area, you can allow the animal to stand over the river. That wound edges, the necrosed tissues are grabbed by the fish in the river. That is a better practice for removing the necrotic tissue. There is a practical tip for you. You can use this technique and you can come back with the results, and you can tell me how it resulted after your experience. This is a fish technique used for removal of necrotic tissue in human being as well as in veterinary practice also if you're in a riverside. And coming to the topical medications again, aloe vera extract is available. Aloe vera extract is again it is on both antibiotic. It is having antibiotic activity and antibiotic properties. Aloe vera extract is increase the rate of wound healing and triple ointment. So always go for a combination of ointments. Triple ointment is also available. The basic acid, zinc, neomycin, sulfate, and polymyxin. This triple ointment has been shown in increasing rehabilitation by 20%. So it goes for better healing of tissue. So you can use antibiotic neosporin ointment or triple ointment, any ointment you can use for your practice. The topical medications again coming to silver dexamethasone, it is gaining in more in human practice. Also slowly we are introducing in animal practice also. This is better used for burn wounds, silver dexamethasone ointments. Commonly used in human medicine to treat burn wounds and promote wound healing. But it is very costly. It is very costly. The Viagra tube will be costing more than 100 or 200 rupees. But affordable, not affordable for the farming practice, but it is useful for the veterinary practice. The nitrofurosome, again, it is a potential carcinogen. Use in food animals is strictly prohibited by the Food Drug and Administration. So even topical administration has resulted in systemic irritation, but it is not outdated. It is silver sulfadazine and is better than the nitrofurosome. Nitrofurosome ointment is not practiced or not advisable for wound healing. And povidone is commonly used povidone ointment. Again, it's coming with a combination of metronidazole also, metronidazole or povidone with metronidazole. Or sucralfate coming with the sucralfate. So combinations are coming up day by day. It is available as ointment or it is available as gel or gel form. It is better applied in veterinary practice nowadays. So in canine practice, you can use this povidone for wound healing or to promote the wound healing or healing process. And petroleum products, although commonly used in non-adherent bandages, it is available. Collagen or petroleum products are available. Used for non-adherent bandages. Petroleum has no apparent bactericidal properties and decreases the rate of wound contraction. So decreases the rate of wound contraction. So it is not out. It is also outdated one nowadays. But some parts it is used as a non-adherent bandaging material. Then again coming to the other commercially available preparations, sabizolone ointment is available. Mefenamic acid ointment is available. Again, we can use for initial wound periods, mefenamic ointment, sabizolone ointments. Then honey. If you are having if you are in a hilly area where you get the honey, so the honey can also be used as wound healing promoters. So after removal of the debris, after lavaging, you can use the honey. You can take a 10 by 10 gauze piece, 10 centimeter, 10 centimeter gauze piece, and soak into the honey and keep it over the wound and bandage it. This can be used at 3 times a day, 1 to 3 times a day. You have to use it continuously. It promotes the healing process. It promotes the healing process. Again, sugar. They used sugar also in previous olden days. 1 centimeter thickness. Suppose if deeper wound is there, you can fill the sugar with 1 centimeter thickness of the sugar in the wound area, then bandage it. This also gave because the wound healing needs a glucose. So glucose promotes the wound healing. So if you are directly providing glucose or honey to the wound, that promotes the wound healing. Again, topical medication, D-glucose polysaccharide maltodextrin. It acts as a hydrophilic agent. So it removes the fluid from the wound area. That is a better place for the eczematous wounds, used in contaminated, infected, and chronic ulcerative wounds, which can be used. And trypsin, balsam, Peru, castor oil. So this is also important wound, important ointment available in pharma. Acts as enzymatic deterrent. It is also, as we told you already, balsam of Peru. It acts as enzymatic deterrent and killing stimulant. It is used for liquid results. So practitioners, Rajan practitioners, you can uh, prescribe this product, trypsin balsam of Peru castor oil, that is available, commercially available in multi-text ointment. It can be used for debridement of ulcerative tissues and decubitus ulcers and chronic wounds. The topical antibiotic again can be used. Topical antibiotic, application of topical antibiotic such as penicillin to a wound or increases the infection rate, decreases infection rate, and does not suppress the wound healing. It will not suppress wound healing, so it can use for you can use it as a topical antibiotic, penicillin, and canalcula. Again, slowly it is coming in practice. That herbal practice powder, it is available as powder. It's available as an ointment. It acts as a local anesthetic and anti-inflammatory action. It has local anesthetic and anti-inflammatory. So pain also relieved. Also it acts as anti-inflammatory. So initial period of wound, you can use the calendula powder or calendula ointment for initiating the wound healing. Then coming to the topical hydrogel wound dressing, it acts as a stimulant. So collagen-based dressing ointments are also available, used in first and second degree of wound, burns, lacerations, dermal ulcers, and abrasions. The gentamicin sulfate available, the live yeast cell derivative also available. This yeast acts as a healing stimulant and used in repair stage of wound healing. So gentamicin also available as ointment, 0.1% and 1% ointment, better placed in skin grafting. So during skin grafting, this gentamicin sulfate ointment is utilized. Then coming to that, so we have seen the wound healing process and what are the lavaging techniques and what are the topical ointments available, topical preparations available. Now, after application of ointment, some wounds need some extremities wounds. Suppose wound in the extremities or wound in the tail or wound in the body surface, which needs some bandaging. So the bandaging is 3 layers. It has 3 layers. One is contact layer. We know that is a contact layer, intermediate layer, and outer layer. So contact layer is the layer which provides the antiseptic, or it provides the bed for medications. So it degrades the tissue, deliver medication, transmits the exudate. So it transmits the exudate from the wound to the outer layer and forms an occlusive layer. It also prevents the excess moisture to the wound level, prevents the outer environmental condition to the wound. It prevents the environmental contamination from the wound. So this is about contact layer. Intermediate layer, it provides absorbance. So we will be using cotton. The intermediate layer, we will be using cotton. It acts as an absorbent layer. And outer layer, we will be using it bandage. So bandage cloths. So it immobilizes. Bandaging also immobilizes the underlying layers and protect from the external environment. So there are 3 layers we have to use whenever you are going for bandaging. So this is the bandaging benefits of bandage. Suppose if you are using a bandage in the limbs, you introduce in the paw level, you introduce the cotton in between the paws because it goes for it will not be pressurized and blood supply will not be compromised here. It will not be affected. There won't be swelling on further days. So bandaging again, it is available in 2 forms. There is contact layer. In contact layer, there are 2 forms of contact layers available. One is adherent contact layer and non-adherent. Adherent means it will adhere. It will stick to the wound and it will act. Whether non-adherent, it will not stick to the wound, but it will deliver the medication, deliver and sucks the X-ray. So this is the difference between adherent layer and non-adherent layer of contact layer. Again, in the adherent types, there are 2 types of adherent layer. We'll move on to adherent layer. Dry to dry dressing. This will be more confusing one to you, but if you understand, it will be better. So dry to dry dressing and wet to dry dressing. So dry to dry means what happened? You will be keeping a dry gauze. You will be keeping a powder. You will be keeping a powder smeared gauze over the wound. So that is a dry. Whatever you are keeping over the as a contact layer, if it is dry, that is called a dry. And what will happen? So after, if you are keeping it, the exudates will be absorbed by your contact layer. Your extruder will be absorb the contact layer, and an intermediate layer will absorb the fluids from the contact layer, and it will be evaporated from the environment. So what will happen after 3 to 4 days? If you're keeping it the dressing for 3 to 4 days, again the wound will be dry. If you're removing the dressing, whatever you are kept on the dry contact layer will be dry only. So this is called as dry to dry dressing. Please understand, dry to dry dressing. Wet to dry dressing. What will happen here? So that the same gauze piece is smeared with the Dharmaceelan liquid, or it is smeared with the Veterinary liquid, or it is smeared with the ointments. So it is a wet. So you are applying a wet bandage. You are applying a wet bandage with immersing into an ointment, or immersing in the Veterinary, or immersing in the Dharmaceelan liquid. Anything. If you are keeping a wet, what will happen? This also will absorb the fluid. This also will dry after 3 or 4 days. This is called as wet to dry dressing. So you are keeping a wet dressing, wet contact layer. When you are removing it, it will be dry. It will be dry. So this is the difference between dry to dry dressing. The dry dressing powders are used for dry dressing, and ointments and liquids are used for dry dressing. This is the difference between wet to dry dressing and dry to dry dressing, and both are adherent layers. Both are used in adherent layers. So this is wet to wet dry dressing. So again, when you are keeping a dry one, it will evaporate. So moist one, again the waterproof one, if you are using water, again it will evaporate, and this keeps the environment, wound environment dry. So this is between dry to dry dressing, wet to dry dressing. Again, coming to the adherent bandage, again we told used when the wound is copious quantities. When you have to use the dry dressing. So when the wound is oozing, when serous is oozing from the wound, initial period, after treatment stage, what will happen? There will be serous, continuous serous formation. So in that wound, you can copious quantities of serous is low viscosity fluids exudate coming. In this wound, you can use the powder, or you can use the dry dressing bandage for the wound. When the thick exudate is coming, not copious one, but it is a sticky one. It is sticking over the wound. In that condition, you go for a wet dressing. So this is the difference between where to use the dry dressing and where to use the wet dressing for the wound. So again, aftercare. So why I put aftercare? When you are removing the dressing, try to moist the intermediate layer as well as the contact layer to avoid peeling of the tissue. Only you have to remove the dressing, a contact layer alone. If you are removing a dry layer as such, what will happen? This will create a pinching of normal tissue also from the wound surfaces. So you have to always moist the contact layer. Always, please note it down. Always moist the contact layer when you are removing the dressing. That is the aftercare of the wound care. So when you are removing it dry as such with a hurry, that will damage the normal tissues also. Again, it will come. It has to grow. So that is the practical tip for you. Always soak the bandage material when you are removing it. When you are removing it after 3 to 4 days. Again, non-adherent layer. Here comes non-adherent layer. Again, non-adherent layer means it won't adhere. When you are applying on the wound, it won't adhere. You can easily peel off the adherent layer. That is called as non-adherent layer. It won't adhere to the wound layer. So that is available as foam type, pad type. So this that foam pad type is semi-occlusive type, retains enough moisture, prevents tissue dehydration, promotes epithelialization, prevents maceration. So sterile gauze with petrolactam or coating with the nitropurozone, polyethylene glycol, petrolactam-based antibiotic ointments are smeared over the pad type. It's available commercially. It is available, and it is kept over the wound and bandaged it. After some time, if you're removing it, it will easily come out, and it protects the wound and it heals the wound. That is about non-adherent semi-occlusive pad type dressing. Again, it is indicated for partial thickness wounds, granulation tissue bed, serosanguinous exudate, and the epithelium. It promotes epitheliasis. Used on wounds that have been well debrided, lavage, and have no need of adherent bandage or debridement. So once debridement stage is over, there's no need of debridement stage. Once the granulation started, you can go for non-adherent bandage type. Up to that, you can go for adherent bandage type. After that, once repair stage is started, go for adherent, non-adherent bandage type, and it has to be kept for 1 or 2 days, then again take it out and rebandage it. Then again, that is a pad type. This is foam sponge type. Again, it's available, commercially available, highly absorbent dressing. It absorbs the wound, moisture from the wound. That wounds with a large quantity of serous fluid, wounds with early inflammation, you can use this foam sponge dressing. The sponges should be selected for either absorption or medication delivery, and changes change daily until the wound is producing less fluid. So up to the less fluid, you can change this semi-occlusive foam sponge type dressing. Then hydrocolloid dressing, occlusive, again, duoderm is commercially available in human beings and can be used for veterinary practice. Bandage material in polyurethane packing. The cover is malleable, impermeable, absorb the fluids, repair stage of healing. It has to be used for repair stage of healing. Best for smaller wounds. It's best for someone. It covers the wound, leave it as such for 2 to 3 days. It will heal. The exuderm, duoderm, commercially available names. You can use this non-adherent occlusive bandage layer. Again, hydrocolloid dressing accelerates the wound healing, enhance the collagen coagulant dissolution. It promotes angiogenesis and barrier for external bacteria. Next one is hydrogel dressing, occlusive. Again, that is hydrocolloid. This is hydrogel dressing. Thin composite of hydrophilic polythene oxide polymer between 2 thin layers. This we are commercially available. We are using it. So Sopradulae or Bactigras, commonly available as Sopradulae and Bactigras. You can there's a 2 layer in between 2 layers that the hydrogel dressing is kept in between. You have to peel one layer off and kept it over the wound and bandage it. It covers the wound and gives a good results. In normal wound healing, you can go for this. So this is the hydrocolloid Bactigras. There are 2 layers under each layer. So take the layer and keep it over the wound. It heals faster. Then calcium arginate dressing. Again, this is advanced management. Non-woven felt-like pad made from calcium arginate. It's strongly hydrophilic, so it absorbs the fluid. It fastly absorbs the fluid. It absorbs thread thick. You see, 333% of weight in fluid. Suppose it quickly absorbs the fluid. Any exudative wound, any highly exudative wound, you can go for the calcium arginate dressing, commercially available. Heavily exudative and potentially exudative superficial wounds, not to be used in wounds exposed to the muscles and tendons and bone. It will not produce any effect on the muscle, tendon, and wound. Then this is the commercial names I've shown you. Short zone Aquazel is commonly available in the market. You can go for it and you can use it. So this completes about the bandaging. So bandaging is of 2 types. One is adherent bandage and non-adherent bandage. Adherent bandages are used initial periods of wound where severe bleeding occurs, where a severe serous fluid exudated, highly exudative wounds, you can go for adherent bandage. Non-adherent bandage, low high viscosity fluids, and you can go for a repair stage. Then coming to the specific wounds, I want to stress the specific wounds. First one, burn injury. Again, burn injury, I don't want to waste time. It's almost around 6:25. So I'm going fast. This injury happens with fires, hot hand dryers, stove, electrical heating pad, boiling water, steam, hot cooking oil, heat lamps, electrosurgical units, solar exposure, heat packs. So it is divided into 2 categories: superficial, partial thickness. Only superficial layer, dermis only affected. So epidermis, dermis is affected. Epidermis thickened, erythematic, and desquamated. So only superficial layer is affected. Epidermis is affected. Deep partial thickness, epidermis, and varying degrees of dermis is also affected. So this is the 2 category of the burn injury. You can divide it 2 category. Don't confuse with all category. Only superficial partial thickness. Only epidermis is affected. Only outer layer is affected, and some deeper layer is affected. Subcutaneous edema and marked inflammation will occur if deep layer is affected. Whereas in epidermis, only if epidermis it is thickened, the skin will be thickened and it will be erythematic. The redness will be there. Desquamate, mild desquamation, mild necrosis of the part will be noticed on the superficial wound. The full thickness burn again destroy entire skin. Full thickness burn, and it is indicated by dark browns. So dark brown insensitive layer, insensitive to the pins, leathery, covering edema and gangrene. The burn also causes systemic imbalances. That is called thermal shock. Systemic imbalance, that is called thermal shock, and respiratory thermal injury. Again, it causes lung also. It could affect the lung also because of the fumigation. If the animal is in a shed, if a fume is there, more fume is there. If animal consumes more fume, that hot air will go inside the lungs and damages the lungs. That is called as respiratory thermal injury. This respiratory thermal injury is common in burn injury, where the whole shed is affected and more fumes are coming from the burn area. So this is about burn injury, how it happens. So this is a burn injury case. Here, the total year is lost, and there will be. This is the erythematous. This is the superficial layer. Only this is deep layers are all deep layer are affected. Only this is the erythematous, desquamated. This is desquamation, erythematous, and swelling. So this superficial layer is affected. This is the deep layer is affected. So you have to differentiate with the affections of the area. And suppose if it is deeper, if it muscles and bones are involved, that is much deeper than deeper affection. Then you have to assess the thermal injury, physical examination. Not only the thermal injury, it is thermal burn, all the burn injuries. Physical examination is must. How much part is affected, depth of burn. So how much depth is, whether it is a superficial or a deep superficial or deeper wound or percentage of total body surface area. Suppose DBSA. So this I have given a tabular column here. So this is I have taken from a human and I have modified it into veterinary practice. Suppose if it is suitable, you can use it. This is a head. In human, they are given 9%. One side, you can take it left side. You examine for left side and right side. So imagine left side and right side. If left side head is commonly whole head is affected, you can give 4.5%. If the chest is affected, you can give 5%. Get and affix up into 4.5. This is 9%, and abdomen is 9%, and entire hind limb is 18%. And for there is a entire hind limb, left hind limb is 18%, and from the shoulder, from the elbow to the toe, 9%. So forelimb 9%, hind limb 18%, and body 9%, 9%, chest and body, neck is 4.5%. So this will calculate into the perineum. The perineum also 9%, perineum 1%. So if you are totaling it, it will become 100%. So that is called TBSA, total body surface area. So you have to assess the total body surface area. What they say, if the total body surface area, burn affected total body surface area is below 15%. So please note it down. If it is below 15%, it is safe. The animal will be saved by your treatment. It's very safer side. So if it is more than 50%, needs emergency therapy. So if it is more than 30%, 15 to 30%, so it needs emergency therapy. It needs fluid therapy. It needs wound care. It needs a replacement therapy, plasma replacement, or it needs blood replacement. Anything, you have to assess the blood parameter, hematocrit. You have to assess biochemical values. You have to assess the blood values. Then, according to that, you have to act. If it is more than 30 to 50%, it is better. You can say that even though if you are doing any emergency services, so sometimes I have seen some human beings will be normal for 4 or 5 days. After 5 days or 6 days, due to the thermal injury or lung injury, they will be dying. So that depends on the TBSA. So in human they clearly say that this person will survive, this person will not survive, because according to the injury of the body level. So in animals, there is no formula, but I modified this formula. I don't know how much it works. I modified this one. You can assess like this. You can also tell the owner that total body surface area is affected, because this total body surface area is also necessary for administration of fluid. That I will tell you here. Management of shock. How to manage the burn injury cases. The management of shock. The first 24 hours oral. You can go for finger lactic because of the imbalances in that. You can go for oral. Then fluid replacement, how to calculate the fluid replacement, 4 ml per kg. So you can, suppose if an animal is 100 kg, so you have to go for 400 ml into TBSA, total body surface. If it is 15% into 15. So that is the total requirement of fluid according to the affection. So this is how you have to calculate the fluid requirement in case of burn injury. That total requirement of fluid has to be administered like this. Half of the amount can be administered in first 8 hours. So the fluid has to be, the total fluid has to be administered uh, uh, administered 24 hours. So you have to divide the fluids into 3 parts. The first part is half of the amount has to be administered in the first 8 hours. Then 1/4 of the amount, remaining amount, has to be administered next 8 hours. The other part, 1/4, has to be administered next 8 hours. So after 24 hours, you have to reassess. Reassess the hematocrit, reassess the biochemical value. According to that, if our urine output is very low, if your urine output is not up to the level, again you start that, you replace the fluids with colloid or plasma or blood or albumin level. If urine output is normal, again you can go for other remedial therapies. So this is the total body area. That is called rule of 9. Just go through it, and this is not for animal. This is for human. I have modified it to for animal body surface. So burn injury, again, management of shock, the total protein and the PCB should be monitored. Anemia developed usually 2 to 5 days. Again, we have to continuously monitor the blood levels. So anemia, because anemia will be developing in 2 to 5 days according to the body level of injury. The hyperkalemia, again, normal range is 3.5 to 4.5 in 1 or 2 days. So again, you can best charge is oral or normal saline to avoid to control the hyperkalemia. Again, from the 3rd day, again animal goes for hyperkalemia. I would assess that one, and if it is needed, you can go for you can include the more potassium level in your fluids. And hypernatremia, again, it is a 145 hyponatremia and hyponatremia. The level, normal level, you should know, and urine output has to be assessed. Auscultation of pulmonary rates. You have to auscultate the lung for any lung involvement. Radiographic sign of pulmonary edema. You can go for X-ray also for notice the pulmonary edema. Urine specific gravity, you have to watch it. Edema of the ulcerated area. Sodium levels, you have to change. You have to watch it. Blood pH also, you have to watch it. You have to watch all the things. According to that, you have to select the fluids and administer the fluids in burn injury or thermal injury cases. The management of shock, respiratory support with oxygen. Oxygen has to be administered. If it needs, if it lung is completely involved, tracheostomy has to be performed, or you can go for mechanical ventilation. And expectorants and bronchodilators are also available in dogs. You can go for expectorants and bronchodilators, or in powder forms available for human beings. But for cattle practitioners, you can go for that one. Antibiotics, high protein diets, you can apply high protein diets, and diuretics. You can go for edema, you can go for diuretics. Then wound care, pulling the hairs. Suppose if you are pulling the hairs, it will come with that's epilation. If it epilates easily in deep burn, suppose if in deeper burn, if you are pulling the hairs in the wound area, that will epilate. That it indicates it's a deeper wound. It's not in epidermis. It is involved in the dermis layer. The application of chilled saline or water at 3 to 17 degrees Celsius, they are best. So compression or immersion. So if a smaller dog, if a dog is there, you can immerse in the water. If a thermal injury, you can immerse in the water immediately, not after 5 or 6 hours. Immediately you can immerse in the water, immerse the affected part in the water, or you can pour the water, chilled saline or water 3 to 70 degrees Celsius, and you can check for hypothermia. Suppose if you are immersing it, again if it goes for hypothermia, you check for hypothermia according to the different act. Aloe vera cream, they say it is aloe vera cream can be applied over the thermal injury. This causes antithromboxin. It has 3 antithromboxin action, prevents vasoconstriction and microcirculatory embolism. So this is the aloe vera cream. You can go for other medications such as silver sulfadiazine. In human, they are using silver sulfadiazine, gentamicin, powdered anointment, microphage anointment. You can use for thermal injury. Again, come to the important one, tar. So many of the veterinarians are asking, sir, what to use for tar? If animal, suppose road, if you are laying a road, if a corporation or any panchayat is laying a road, the tar is filled over the things. And animal, the kids will fall over the tar, or the kids will fall over the tar baskets. So there will be tar smearing over the animal. So what has to be done for the wound means you have to use emulsifying agent. You have to emulsify the tar. You have to take up the tar, stick over the animal body. So this is polyoxyethylene sorbiton. This is the best material. It's an emulsifying agent, which can be combined with the other agents. You can use it for the removal of the tar or polysorbate. I told you the ointment is available. Polysorbate ointment is available. You can use it for the ointment. You can apply, suppose if it's a polymer, you can use this ointment for easy practice. So it's for practical tip. When I gone through the books, I catch this one. Butter in a liquid state, kept in a gas pans and kept over the thermal tar pots. So in that for 30 to 30 minutes, it acts as an emulsifying, best emulsifying agent for field level. So don't panic. Ask them to take the butter and in a liquid state. So we'll be doing the butter in our field level area, in our households. So that liquid stage butter can be utilized for is a better emulsifying agent that can be used for removal of the tar. So again, commercially, Weber with E ointment is available, and our mayonnaise. Surprisingly, when I'm going through the literatures, our mayonnaise, sunflower oil, baby oil also have some effects. So mayonnaise for use for the chicken, you use for the kadai chicken or any kebab chicken or chicken, you will be using mayonnaise, or any pizza, you'll be using mayonnaise for taste or tasty to increase the taste. So that mayonnaise can be used for as an emulsifying agent. Sunflower oil can be used, baby oil can be used. So here I want to stress one point is don't use kerosene, don't use petrol, don't use diesel immediately over the wound. They say that it causes further damage to the underlying tissue. So don't go for petrol, don't go for diesel, or don't go for kerosene, because you will be imagining kerosene will remove the thing. That is not that. That kerosene will cause damage, further damage over the skin. So use butter or these type of ointments or mayonnaise and flour for as a emulsifying agent and get it solved. Again, coming to the electrical burns, you got to use diuretics, aminophylline for it causes respiratory damage. So you go for aminophylline. Chemical burns, again, according to the chemical, you can use alkali or alkali or alkaline solutions for to counteract the acid levels or counteract this one. And radiation injury, again, this is not common in our area in India. This is common in the radiation workers, which is they are continuously working in the radiation area. In frostbite, again, this is common in cold area where extreme colds are there, like in northern part of India, where that you can use aloe vera cream, silver sulfate for better better results. Then coming to the next wound, perianal wound. This is also a nuisance. This won't heal properly if you're not treating it properly. This has to be treated with the second instance healing alone. Suppose if your fistulas are there, fistulous wounds are there, connect the fistulous wound. Connect the fistulous wound, make it a single wound. If you are treating a single fistulas, again it will not heal. So connect the fistulous wound into a single wound, then treat it. That will give better results for perianal wounds. So you can advise the owner for use the stool softeners, cremafin. Commonly available is cremafin. Other stool softeners also commonly available. You can use the cremafin. Or you can use the oils also for easy stools which do not strain. That also helps for better healing. The ointments that suggested for this type of wounds are Viprocin ointment, T-back ointment, that is our strap-on ointment, triple antibiotic ointment or wet-based ointment, tacrolimus ointments are available. There are tacrolimus with cyclosporin. This gives good results. In human practice, they are using it. It's mu C. That is tacrolimus with cyclosporin ointment, and they say cryotherapy are also good. If you are having a liquid nitrogen, just test the wound edges with liquid nitrogen. That also promotes for early healing. So again, you can go for coordinated ointment, 1%, fluorexidine 0.5%, 75% solution of silver nitrate. This is for lavage solution. 80% solution of phenol, lubricant solution for perianal wounds lavaging. So you can use lavaging solution of coordinated fluorexidine 0.05%, 75%, it's not 0.5%, 70% solution of silver nitrate, 80% solution of phenol, glucoside solution. This can be used for wound lavaging for canine animals. Then coming to the maggot wounds, this is a major important aspect in large animal practice, where every day you will be getting a case of maggots. So please remember that egg will hatch on third day, even on second day. So if a maggot wound comes to you, tell the owner that they say that they will be noticing today only, but it is not like that. The fly has kept the egg there, and it will take 2 or 3 days to hatch the egg, and the maggot will migrate to the wound and will grow. Well, a well-grown maggot, it will take 5 to 7 days. So if big maggots are there, you can boldly say the wound has the age of the wound is 7 days. If a fresh small maggots are there, the age of the wound is 2 to 3 days. So according to that, you can imagine the age of the wound in maggot wounds. So maggots enzymes, it produces enzymes, infection, toxins, and shock. So if a larger maggot, if a downer cow is having full of maggot wounds, so that will tie up toxins due to that shock due to toxins produced by the maggots. So maggots produce toxins, and toxins carried by the rheumatogenic wound and causes shock in animals. So in case of large maggot wounds. So how to treat it? So if you are arresting oxygen in the tissue level, that is the principle in treating the maggot wound. If you are arresting oxygen in the maggot wound, that will automatically the maggot will come out of the wound for oxygen deprivation. It will come out of the wound, and you can remove it. That is the principle behind keeping the turpentine ointment, turpentine, coconut oil, neem oil, anona, that is sugar apple, camphor, and combination of these one. If you are all keeping it, this will cause deoxygenation. This will cause deoxygenation over the surrounding area. So for oxygen, these all maggots will come out of the wound, and it will appear over the wound, or it will fall from the wound surfaces. And all your sprays, commercially available sprays, and also the ointments available for the maggot treatment is also concentrating this oxygen deprivation. That's why the maggots are coming out when you are pressing the spray or applying ointment over the wound, maggot wound. Ivermectin, use of ivermectin. You can use ivermectin in dogs as well as in large animal practice, but it has to be repeated after 3 to 5 days, because again fresh egg will be hatching after place will be sitting over there, and again it causes maggot wound. So repeated dose is necessary. Please note it down. Repeated dose is necessary after 3 to 5 days when maggot wound comes to you. If you want to use ivermectin, repeat the dose in 3 to 5 days. That is my practical tip for you. Then Camopox and Propoxer and sulfonamide ointment that Negasan presently available is giving good results in maggot wound. The selective product should be whatever the product you are selecting it, commercial product for maggot wounds. It should have a fly repellent action. It should have a maggoticidal action. It should have a bactericidal action. It should have a wound killing promotion. So these, if you are seeing a product, if you are seeing a maggoticide product, if the product is having all these components, if it is having fly repellent component, if it is having maggoticide component, or if it is having bactericidal component, or if it is having wound killing component, you select the product. You select the product and use it properly. It will heal the wound properly. It will heal the wound earlier than what you can imagine. They are coming to the teeth wounds. So I want to stress here the linear teeth wounds. So here it is a horizontal teeth wound. So if the wound is linear, it will heal faster. It will heal faster. Where if it is a horizontal wound, because it will cut the nerve endings, it will cut the blood vessels supplying to the tip of the wound, up to the tip. So what happens when you are suturing it, or when you are taking an open wound, this will take more time than the linear wound. So better, if a linear wound, it will heal faster. If it's a horizontal wound, it will take time for healing. That's the thing I want to emphasize on the teeth wounds. So linear wounds will heal faster than the horizontal wounds. Collagen-based ointments are more suitable. Quick heal or Gemcol, so many companies are available for early healing. Collagen-based ointments, whatever the ointments available commercially, you can go for that ointments. 1% fluorinidine plus 10 ml glycerin. Again, 10 ml glycerin, you take 10 ml glycerin and 1% fluorinidine, mix it and apply over it. Again, the glycerin will give glucose to the wound area, and fluorinidine will control the bacterial growth. That will heal faster. So we are practicing it nowadays. 1% glycerin fluorinidine. Take 1% fluorinidine and take 10 ml of glycerin, mix it well, then apply it over any chronic wound, ulcerative wounds, or any exudative wound that will heal better than other one. So lanolin spray is available with the combination. You can use this spray for 100 people. Again, septic wound appears as small punctured wound. All wounds are contaminated wound, and explore the wound. Again, I told you, explore the wound. If it is extensive, we can close the wound with the proper drainage. Or otherwise, you have to treat it as an open wound. Septic wounds are not closed completely. Should have a way for elimination of the fluids present inside the wound. The synthetic non-absorbable monofilament suture. If you want to suture, you can use polyamide. You can use polyamide, or you can use polypropylene. You can use polypropylene materials for suturing the wound in the septic wounds or bite wounds, because that will not have any capillary reaction. That since it's a monofilament, it will not cause any much reaction over the wound surfaces. And coming to this is one of the important thing: granulation, proud flesh. That is exuberant granulation tissue. Proud flesh is it is common in the joints, near the joints, where the movement is commonly occurring in the wound area. So epithelialization will not occur. This will grow over the skin level. Or the granulation tissue will grow over the skin level. So it not heal. So to heal this, so below the knee or calf joint is common. Prolonged duration of bandage. This is also due to prolonged bandage. Application of steroid, topical, and intralectal. So how to treat this? You can apply steroid. You can apply steroid, or topical steroid ointments are available. Topical steroids or intralectal steroid. Inject intralectal steroid. This will cut the granulation. This will stop the arrest of granulation tissue. This will promote the healing by epithelialization. And caustic agents application like copper sulfate crystals. You take the copper sulfate, ground it nicely, then smear over the wound and bandage it. This will remove the excess granulation tissue. This is acting as a caustic agent. This will vanish that. This will clear the next tissue when you are removing the bandage. And you can use chemical group crystals also. Potassium permanent crystals also you can use. The contact time should be 48 hours. 48 hours it has to be applied. Again, until the wound lips are so the granulation, whatever you are treating it, it has to be applied until the wound is closed. Again, nowadays we are practicing prednisolone. So this is field level tips. Field veterinary, please note it down. If it is exuberant granulation tissue, take 10 tablets of prednisolone tablet, 5 mg tablets, and plus 20 plus a tablet of metronidazole, 200 milligram, 20 numbers. So 10 metronidazole, 20 metronidazole tablets, 10 prednisolone tablets. Ground it well and smear it over the wound. Excess granulation. This is easier for your practice. Bandage it, leave it for 48 hours. So this has to be done up to the healing level, up to the normal healing. Again, lidocaine, hydrocortisone acetate, and zinc ointment and allantoin shield. So this is a better. They say it is a better. Literature says it is a better healing effect in proud plus condition. This is available as shield, ointment shield. Again, it acts as a debridement. It acts as a debridement agent as well as healing agent. Then, so this is about common conditions occurring in the field. I have answered all the questions of common conditions, what we are encountering in the field levels. Now we are moving to the solutions. What field level problems and solution. So cleaning the wound. So use of any cleansing solution, whatever I told, tap water with the chlorine, tap water with the carbenophore, tap water with the chlorhexidine, tap water with the carbenophore or acrylamide. Whatever the solution it is available, you can use it for cleaning. Chlorine, chlorhexidine, carbenophore, whatever things you can use it on that particular concentration. So when to use ointment? So my friend from Madurai, a good practitioner from Madurai, yesterday called me and said, I want the answer for this question. When to use ointment, powder, liquid, and gel? So powder. So commonly available powders are boric acid powder, zinc oxide powder, and sulfur powder. The sulfur lamide powder, or you can use the sulfur powder. So boric acid powder, it's a weak antiseptic. It has to be used as a 2 to 4% solution. So please note it down. It should be, because it is also available in every hospital. It is available, boric acid powder. So use the boric acid powder as a solution, 2 to 4% solution for cleaning. It has a soothing effect, and it can be used in irritated mucous membrane, vaginal mucous membrane. If you wash the vessel mucous membrane, you can use the 2 to 4% solution. Also, why we are using conjunctivitis? So in our period, our teachers will say, use boric acid powder, use boric acid solution, boric acid lotion. So 2 to 4% lotion, boric acid mixed with the water or normal saline. You can use it as a conjunctivitis, severe conjunctivitis condition, because conjunctivitis there will be irritation. So it prevents the irritation. So please note it down. Irritated mucous membrane, boric acid is better. Use better solution. Use as a better solution. 2 to 4% solution of boric acid. It gives good results. The BIP ointment, again coming to the powder, bismuth supplemented diazepam paraffin paste. Bismuth supplemented diazepam paraffin paste. It product irritation. Again, it also irritation. Adherent property. It produces adherent property. It has a debridement action as well as healing action. So chronic wound, chronic ulcerative wound, you can use the BIP, or you can use it for exuberant granulation tissues also. Then coming to sulfur powder, it should be used in the wound with the pus. So other normal, it has to be used initially. So sulfur powder is best for inflammatory stage and inflammatory stage and repair stage. So once the tissue has been repaired and granulous tissue formed, won't use sulfur ointment. So up to that, you can use for sulfur ointment for hydrophilic action as well as antiseptic action. Sulfur powder, available sulfur ointment powder, commercial available. It should not be used with the wound pus. So if it is a pus, if a septic wound or if it's a purulent wound, don't use the sulfur powder. The liquids, commonly available liquids are chlorinated chlorhexidine, and your teramycin liquid. Teramycin liquid, previously we used to use the teramycin liquid for bandage, but since so many ointments, so many collagen-based bandage pads and packs came out. So nowadays, slowly we are not using the liquid, but it can be used. Teramycin liquid can be used as a wet bandaging solution, or you can use the poronidine, 5% poronidine, 2% chlorhexidine can be used as a wet bandaging. The ointments, please keep it in mind, ointments has to be used in granulation and repair stage. Once the granulation tissue is coming out, use the ointments. Up to that, use the powders or use the antiseptic wet bandage or dry bandage to clear the organic material, to clear the bacterial contamination. Once the granulation tissue, I told you, granulation tissue is devoid of bacteria. Granulation tissue is resistant to bacteria. So once the granulation tissue occurs, go for ointment preparation, any ointment preparation, and it's better for repair stage. So this is about answer for when to use powder, when to use liquid and ointments. Then, how to speed up the wound healing? So you can use supportive therapy. When you are giving supportive therapy, that promotes wound healing. But best supportive therapy is vitamin A. So we have vitamin Vitade available, or other commercial preparations available. ADE3 is available. You can use that vitamin A. It promotes fibroblast proliferation. If it's excess, it induces inflammation. So once it should not be administered continuously. Once you can administer, that is enough. It is enough for taking care of promotion of fibroblast proliferation. So again, PRP. Again, this is in a research stage, or it is in the field level. Used in the pet practice. Collect the blood, centrifuge it into 2000 RPM. The superinduced fluid, that's puffy coat, contains rich platelets. That you can take the superinduced fluid that can be used as a wound healer. That can be smeared over the wound and apply bandage. That also heals, promotes the wound healing. Collagen preparation. So many collagen preparations are available in day-to-day practice. Update your knowledge on collagen preparations. Whatever the commercial preparations available, you can use this collagen preparations for easy or better wound healing or early wound healing. Then Zigox ointment has to come in that. Zigox ointment, 20% ointment is available. It acts as an acid, it absorbs the fluid and antiseptic ointment. Helps for epithelialization. It helps for epithelialization. So that's why I told you when epithelialization is not started, the wound is very chronic wound. If it granulation tissue comes on, but epithelium is not started, granular contraction not started, you can use the Zigox ointment for re-epithelialization. Then, so we are in final stage. So recent advancement in wound management. What are the recent advancements in wound management? I am not going to touch on this. Please go through the literatures and please go through the nets for the preparation of for the available recently available one, nanosilver ointment. So nanosilver ointment, they are broad spectrum based, effective against MRSA, methicillin resistant Staphylococcus aureus. So in that, if you're ABST, if you're putting ABST and if the Staphylococcus aureus is present, this ointment gives good results. So nanosilver ointment, nowadays nanosilver. Again, nano ointments are coming now. So many nano ointments are coming. Our Tanos also produced a nano ointment for wound healing that also coming in commercially available. So you can choose the nano ointments for better early wound healing. Then application negative pressure. The NPW wound device for wound treatment in NPWT, negative pressure wound treatment. See the picture here. So they are creating a negative pressure over the wound to promote the healing. They are creating a device with a device. They are creating a negative pressure. They suck the air. They are creating negative pressure and for better wound healing. Then skin substitute. So there are so many in human being. There are so many skin substitutes available. They are using for burn injuries. Collagen based skin substitute or skin grafting based skin substitutes are available. Substitutes are available for recent days wound management. Then growth factors. Again, growth factors also mixed with the biological wound products with ointments. This is also an advancement in wound healing preparations. So growth factor based ointments are also available in the markets for human being use, and it also used for promoting wound healing, early wound healing. So hyperbaric oxygen therapy. Again, it's a newer one. So it's animals are put in the oxygen therapy chamber. Animals are put in the oxygen therapy chamber and they close the. See the picture. They will close the chamber and 100% oxygen is introduced into the chamber and gives. If the chronic wound is there, it absorbs the wound absorbs the oxygen. They say there will be oxygen level increases to wound bed oxygen level 0.3 to 0.3%. So up to that, it will increase the oxygen level in the wound tissue level, so it improves the wound healing. So this is all the newer management, recent management in wound, recent advancement in wound management. And this is the wound what we encountered, the sunburn wound, where the animal is kept. Animal met with an accident in the road, and it was kept in the road in the sun for more than 1 or 2 days or 3 days. So when it came here, so all the skin burned out by the sun rays in the summer. So what would be the treatment? Again, it has a evisceration intestine also. So treatment with sutured treated with the suturing agents and ointments to heal the conditions. So if this is a sunburn, somebody will ask whether whether the skin will grow or not, the hairs will grow or not. Hairs will not grow because it likes a burn injury. It is a burn injury. So hairs will not grow when the scar tissue is found there. So that is the thing they will be asking you in the practice. Hairs will not grow on the burn wounds. So this is a wound with a fracture. So this modified one, I am using it nowadays in a day-to-day practice in sheep and goats. So if a wound comes with a fracture, so you have to treat the wound. You have to when a fracture comes with the open wounds. My professor used to say that you concentrate on the wound, don't concentrate on the fracture. So primary principal treatment is you treat the wound and go for fracture management. If you're not treating the wound, again it goes for osteomyelitis, the fracture also will not heal. So proper treatment of wound is important when a fracture occurs with the wound. So for that, vent has to be kept for wound treatment daily. The wound has to be daily dressed for early healing, then only the fracture will heal. After that, only the fracture will heal when the wound is exposed to the fracture site. So this is the modified one. If you will be knowing that this is a instead of modified POP cutter splint, is a PVC splint is applied and a vent is made over the wound for easy bandaging of easy dressing of the wound. So this can be practiced. This can be practiced your regular practice. So this is a commonly we are practicing in our practice in our academic hospitals. So you can also use it in the field level for this. Why I'm insisting is you can put this bandage and you can ask the owner to daily test the thing with the ointments or other things. So you will not be disturbed regularly. If you are putting a small normal bandage and it will smear, it will wet and they will coming regularly to your hospital for management. So if you are leaving this as and you are giving a oral antibiotic and how to bandage it with the ointments, they will be treating on their own. So you will not be disturbed and also the healing also will be better. And sometimes the owner will be asking in this condition. The entire thing is sloughed off. Only skin is left out. So what could be that? They will be saying that you should unite this. Even if you are uniting this, if you are uniting with any orthopedic management, that will not heal. So once the nerve endings or blood vessels are cut, you should go for amputation only. If you are treating it again, it goes for necrosis. If blood circulation are not, if blood circulation is completely arrested, if there is no circulation, if there is no sensation at all, this wound has to be treated as you have to amputate it and you have to treat it as open wound, or you will close the skin and you have to treat it as such. So when a proper circulation, nerve impulses are there, proper circulation is there, that wound will heal faster. Otherwise, there will be delay in wound healing, and your decision is best. You have to take a decision. You have to educate the owner. You have to educate the owner. That is the client education is more important than the treating the client, treating the animal. That you have to educate it and you have to treat the wound accordingly. Then, so this is the damage. So this is the severe damage over the vulval lips. So you have to use suturing agents. You can use boric acid. You can use glycerin with the poronidine, or you can use acryflavin with the glycerin. So like that, you have to use suturing agent and to improve that, to remove the necrotic tissue and to improve the proper healing. So this is a necrotic tissue. Again, we have smeared copper sulfate. This also removes the necrotic tissue. So you can use the copper sulfate, smear the copper sulfate over the wound area, that will clear off the necrotic tissue and that will heal faster when you are applying it for going for Dharmaceelan liquid or any ointment after that. So to complete this, again, if your wound comes, clean the wound with the lavaging solution, make the wound clean, very clean, and apply any contact layer, adherent contact powder. Apply, suppose if it's a fresh wound, apply powder, adherent contact layer, or if you're a granulation wound, a non-adherent contact layer, you apply non-adherent contact layer over that. If you are able to bandage, you can bandage it, otherwise leave the wound. And if you're applying it, you can. So after care, so client education is important. Frequent observation of animal behavior, self-mutilation has to be watched, swelling has to be watched, adequate rest has to be given for the wound area or animal. Bandage care. So you have to remove the bandage one in 2 days, and you have to reapply the bandage. And during removal, I told you, soak the bandage and remove the bandage. So if a mutilation, animal is mutilating the wound and it is not healing properly, you can go for any preventive measures. You can go for e-collar. So this is the commercial e-collar. This is homemade e-collar, where the water cup is used as a e-collar for the low cost things. So economic importance, farm animals, the farmers will be worrying about production worry. So especially in the wound in the limb area, wound in the udder, or wound in the near the eye, it will irritate, the vulval wound will irritate, the production will be lost, so they'll be worrying about the production. It's one mental worry. If pet owners are worried about the wounds, suppose any small wound, they'll be worried. Oh, my dog is having wound. So what happened? Like they'll be worried. So you have to treat the animal and educate the owner according to the condition of the wound. The cost of treatment also has to be carried out, has to be calculated in case of common illness. Number of days of treatment that it will be reduced by your management. The frequency of application also reduced by your management. Early healing is better. So summary, you have to assess the wound, selection of proper wound dressing agents, wound immobilization, timely reassessment, low cost technique. Use low cost technique for farming community. That is better for their happiness. So thank you, Alembic entire team, for giving me the opportunity to share my knowledge with the veterinarians all over the globe, not only in India, all over the globe. Thank you, entire Alembic team, especially Mr. Karnanadi, Vice President, Senior Vice President, Alembic, and his team. So happiness is the economic importance in animal practice. So if a owner is happy, we are also happy, but vet also happy. So that is the happiness is the economic importance in any animal practice. So thank you. This is our new visitors in our department. So this comes in once in a week or once in 10 days. Again, we know, I don't know whether it comes out with the wound also in some days to our hospital. So thank you very much. Thank you all. Thank you for patient care. Thank you, sir. So I completed my topic.
And for all the participants for listening such a long presentation, I'm sure it is, though it is a long presentation, it is very much useful because doctor has covered wide range of wounds and its treatment options. So I'm sure it is very much useful. My team is collating the questions. By the time they collect the questions, I request my team member, Dr. Naresh Kulkarni, to present one product, 5 minutes presentation. After that,
the question answers will be compiled. I will take you to the, sir already taught in detail regarding the what are the steps to be taken in the treatment of the wound. First is the control of bleeding, followed by prevention of microbial infection, then fly repellent and mycoticidal, and controlling the infection. This is the four most important step in control for the treatment of the wound. And if you consider the spray which are the present in the market are all are the herbal preparation. If you consider that why allopathic spray is needed, so we had a talk, we got a lot of discussion, and we come up with the preparation in allopathic form. And our concept for bringing the allopathic spray is that it should have anti-infective action, it should be insecticide, it should have fly repellent activity, and it should be mycoticidal. If you use allopathic spray, the wound healing will be faster as compared to the Ayurvedic spray. And control of maggot will also be faster, and the you can see that healing process will also be faster, and the predictability of the cream, gel, and powder, always the spray is superior in that. In that regard, if sir already discussed in his presentation, the ideal wound healer should have antimicrobial, antimycoticidal, and fly repellent property. If you have all this property, then which sir told in the presentation, saying that whenever you are choosing any product for the wound management, it should be having the property of antimicrobial, antimycoticidal, and fly repellent. Whether all this property can be find in one product, yes, it is available. That is Almizole wound spray. I'll take you through a small video. And this is the first time in India combination is the allopathic spray containing the cypermethrin, that is 0.125%, as junction violet, chlorocresol, and dichlorophene. It is available in 100 ml and 250 ml pack. Now we'll see the uh, ingredient property. Why we chosen this four ingredient? First is the cypermethrin, as you know, is belong to the synthetic pyrrolide group. It is cypermethrin is neurotoxic to the insect, and it kills the maggot in direct as well as with the ingesta, and it is its efficacy is very efficacy duration is very high, so the healing process will be faster. But whenever we introduce this product with the field veterinarian or the researcher or with the student, there is always we used to get a question whether cypermethrin is safe. Sir, we have used the cypermethrin at very low dose. In that dose rate, if the absorption with the skin is very less, if it get absorbed also, it will be quickly metabolized into liver to non-toxic metabolite form, and it will be excreted through the urine with the help of glucuronidase enzyme. And sir, that's why we are saying that this albendazole wound spray cannot be recommended in cat and horses because glucuronidase enzyme is not present. Whereas rest of the animal you can recommend albendazole wound spray. And this cypermethrin is very safe because the dosage is less. If it is absorbed also, it will be excreted as non-metabolic form. And as you know, why how it is neurotoxic. It got a lot of mode of action: oxidative state, DNA damage, voltage gated sodium channel blockage, and chlorine channel blockage. Like this way, it will act on the insect, and it will paralyze the insect, and it will be act as a magoticidal. And most important is gentian violet. It is also known as purple color liquid, known as crystal violet or methyl violet. It got numerous property. It started from antifungal, antibacterial, antiviral, and antibacterial property also. The mode of there are multiple hypotheses regarding the antibacterial, antifungal, and antihelminthic property of gentian violet. But in regard to the wound, I want you to just have it got dual action. If you are using this gentian violet in the animal skin, it is mammalian skin, it will act as an anti-inflammatory, and for the bacteria, fungal, and parasite, it will kill the parasite. So it has dual action, anti-inflammatory as well as killing action. There is a spectrum of activity of gentian violet. As you know, in human being, any dermatological treatment start with the application of gentian violet. So in veterinary practice, this is the first time we will launch in the spray form, gentian violet. Then we got chlorocresol. It is halogen phenol derivative. It is similar to our Dettol, but there has some molecular structure differences there. It got tropical antiseptic agent. It inhibit the growth of bacteria by causing a leakage to the cytoplasm. Okay. Sometimes it causes uncoupling of the membrane with the protoplasm. It will boost the wound healing process as well as it is most if you can use it in a keen infection abrasions. What are the type of ion? Dichlorophene is also similar to the. It is belong to the halogen phenol derivative. Its activity is also similar to the chlorocresol. And what are type of the indication where you can use this albendazole wound spray is maggoted wound, deep-seated wound, septic wound, surgical wound, post-sharing region in sheep, fungal infection of skin, and wart region on mammary gland. That is uh, uh, thylitis or mammary thylitis, you can use it. And dichlorophene, already I told it is similar to the phenol derivative. Okay, it is also help in the wound healing process. It is available in 100 ml and 250 ml pack. MRP is 160 rupees for 100 ml and 350 rupees for 250 ml. These are the indication where you can use. Thank you very much. Now I will request Dr. Amit to take the question, please.
Thank you, sir. Thank you very much. And thank you to Sir Dr. Dharmaceelan, sir, also. Sir, there are a lot of questions. However, we have compiled few, and I will be sharing those questions in front of you, sir.
Okay. Yeah. Some audio is disturbing. Okay. Can we what's question? Suresh Kumar, can we switch the talk by whom you will see? I told you again it was septicemia. Unless if if you are count that if you will be controlling within 6 hours of period. If the doctor is 6 hours of period, then patient not you can go for suturing or thorough. The PCR, old because once it is granulation started, then you can think of how to put the to heal early. I told you that you selection of the product to select the product also conditions. So anti-magnetic should have anti-magnetic activity, should have anti-magnetic activity, should have apply activity. So select a product which is which all acts in surgical for serious surgical site. I don't understand Dr. Surendra. In surgical mode to make a pain for serious surgical site. So if it is surgical mode, if it's serious from cavity to the cavity. Otherwise, there is no need of surgical. If you are if you it will form that formation fluid that is from a cavity to go for drain. There is drains are various drains are available: passive drain, active drain. So you can use the simply you can use the drain sheets are available, commercial sheets are available, drain tubes are available. You can fix the sterile drain tubes into the cavity, and once the drains are the serous exudate is the quantity of serous exudate is lowering day by day. Once it is lowered, then you can think of closing the valve. And next question is, what should be use of hemostasis while removing outflush from equine wounds? Dr. Chandan Saul. So, if you are having equine wounds, equine pain for outflush, so bandaging is better even in case of any thing with that. We are combination of drugs. We are using corticosteroids and metronidazole, or we can go for a big ointment, or if you are having a cautery, so you should have cautery if suppose it bleeds more. Otherwise, the bandage itself it will cover the bleeding. Surendra, next question: in case of a tumor before udder during a surgical removal, how to reduce the empty space, how to reduce the exudate drain? Again, if you are removing the necrosed udder, that skin will adhere to the cavity. That slowly during granulation, the skin will adhere to the cavity. That will completely close after 1 or 2 weeks. There's no worry about it. But you have to keep the cavity clean. That is your main aim. You have to keep the cavity clean. You can use the antiseptic and lotion, and you can keep the antiseptic off. Slowly, day by day, the cavity will the size of the cavity will be reducing. Tail cut injury, it canines your management of wound, please. Tail cut injuries, again, bandaging is very difficult. You have to apply adhesive tapes to secure the bandage, and you have to apply collar also. That's the main thing. You have to advise collar, and also you have to try to apply bandage. Some in human beings, what human beings, dogs, sometimes they will be suturing the bandage layer, taking a bite of the bandage layer with the skin, and for better securement. But it will cause pain. But secure, you have to make a secure bandage. Then when I can't, should we remove the scab during wound healing as we reduce the contraction? Yeah, during contraction you can slowly reduce the centripetal. Suppose contraction is, I told you, centripetal contraction. So afterward the scab will be drying out. That dried scab can be removed by your surgical debride. Harshit Saxena, sir, how to protect the wounds from getting infected with those by bandages like
sir, which can't be closed by bandages like
which
surgical wound? Yes, sir.
How to protect the wound from getting infected, which caused by which what is that? Which I don't know. I couldn't read this one.
Sir, the
Which
question is, sir, how to protect a bandage, protect wound from getting infected, which cannot be closed by bandage, like surgical
close.
wound. Yes, sir.
Yeah, that you can apply a body bandage or belly bandage. So what normally they are using, suppose if a neck region is, you can apply a bandage on the neck, or if animal tries to more vicious animal, you can go for a application of a body bandage. So if you take a cloth and make a knots over the lumbar area or over thoracic area, you can secure it. And in that condition, you have to apply for, you have to go for e-collar. E-collar is the best one to for early better healing in small animal practice or in cat practice. If if animal is more joyful animal, it will lick the wound immediately after application of ointments. Any large animal also. So to protect that, you have to protect. You have to take a cloth and you sterile clean cloth. You can apply over it, and you can cover the wounds.
Thank you, sir. Thank you very much, sir. There were so many other questions also, but however, we have compiled a few, and remaining questions will be shared to you. And sir, those questions you can reply through mail also. Sir, now I would like to hand over the session to my superiors, Dr. Santosh Shinde sir or Mr. Karunanidhi sir. Santosh sir.
Yeah. Okay. Thank you, Amit. Thank you very much, sir, for such a nice presentation, informative presentation. Now we'll proceed with the vote of thanks, sir. A warm and graceful evening to one and all, and Honorable Dharmaceelan, sir. It is my privilege to propose vote of thanks speech to those who really work hard to make this webinar successful. On the behalf of all the participants and Alembic Pharmaceutical Limited, I would like to express my sincere gratitude to Honorable Dr. Dharmaceelan sir for such an informative, practical and applied presentation. All the part of wound healing, all the wound sir has covered. Sir, your presentation definitely will help the field veterinarian, student as well as faculty for their day-to-day clinical practice. In future also, sir, we would like to take benefit of such interesting and useful topic that will enhance the knowledge, our knowledge, and we can serve the society. I will also like to thank all the participants and Alembic field staff, Mr. P. Karunanidhi, Senior Vice President, for his continuous support and guidance, Mr. R.K. Sharma, AGM Sales, and his entire field team for making this webinar successful. From my team, I would like to thank Dr. Amit, Dr. Naresh, Dr. Thomre, and Dr. Sanjay Latkar for making this webinar successful. Once again, thank you to all the participants and thank you to Honorable Dr. Dharmaceelan, sir. Thank you very much, sir.
Thank you. Thank you. Thank you for the opportunity given to me.
Thank you, sir.